you can. Smile when you can. Cry when you can.
Hello, everyone. Good evening from my end, and good afternoon and good morning to people watching from different parts of the world. It's another talk show, Precious Derrick talk show, and I'm so excited because today is all about women again. You know, I'm so passionate about women. So before we go ahead, I just want to welcome you. If you're here with me, let me know on the comment section that you're here. I have to wait for you guys to come on because this show is packed, is loaded. So we want to get as many people on board as possible. So if you're here with me and you can hear me loud and clear, let me know in the comment section. You can hear me. If you want me to raise my voice a little bit, let me know as well. You want me to raise my voice. So just please talk to me, let me know. But I can see 5 people already. Welcome to today's show. It's been a long time, isn't it? With everything going on, but thank God we are back today. And it's a loaded show, actually. So let me know if you're here. On the comment section, let us know that you're here. So we can welcome you because everyone is important. Everyone is welcomed. Everyone needs to feel welcomed as well. And if you're here as well, I would also like you to please share on your WhatsApp, share on your Facebook, share on Instagram, share, so we can get as many people as possible. Yes, I'm waiting for you guys. Are you here? Where are my friends? Let me know on the comment section. We don't want to be quiet today. We want to make the comment section a little bit busy today. So say something if you're with me, so I can say hello to you before we go ahead. I know people are here with me, but I just want you to say something. Say something so I can welcome you and share. Thank you so much. So if this is your first time, my name is Precious Derrick. On this whole talk show or my YouTube channel, I help you understand that family and relationship is a work in progress through my videos and through my talk shows. So if you're new here, please consider to subscribe to my channel. If you're not following me on Facebook and on Instagram, please do so because I've got so many things lined up. And from today's section alone, you will know that this evening is not going to be like a time wasted. It's going to be time well spent. So I want to start by introducing our guest. I know that you guys are here with me, but you're going to catch up. So I want to start by introducing our guest. First of all, I have to bring her on so she would see and know that you guys are here with me as well. So just a minute, let me bring my guest on. Just a minute. Hello, good afternoon, madam.
Hello, good afternoon, Precious. How are you?
I'm fine, thank you. How are you, ma?
Fine, thank you very much. Thank you for inviting me to the Precious
Thank
Derrick.
you. Thank you so much for coming on my show. So I just want her to come on so you can be, while I'm introducing her, you're going to be looking at her face and be thinking, oh my God, this woman achieving all of this. So that's why she's on, so you can be looking at her face and see how beautiful she is. So we've got our Dr. Loretta Obgoro-Okor. I know she's going to kill me the one pronouncing the name.
I'll let
And
you off today.
okay, that's fine. And her MBBS from the prestigious University of Benin in Nigeria, MSc in Public Health Research from the University of Edinburgh, and another MSc in Clinical Education from the University of Sheffield Hallam, both in the United Kingdom. Loretta is currently doing a PhD in law and criminology at the Sheffield Hallam University. Dr. Obgoro-Okor has been able to blend her work in the science field of medical practice and with being an author, a passionate motivational speaker, a women and youth health advocate, and educationist, as well as social entrepreneur and a blogger. She has also co-founded a foundation, a charity with the vision 21st Century Health for Africa. She's a member of the Royal College of Obstetrician and Gynaecologists here in the United Kingdom and has worked in the NHS now for over 10 years. Dr. Obgoro-Okor is passionate about tackling women's reproductive and mental health issues, as well as clinical stimulation expert and author of a book, My Father's Daughter. On top of all of these qualifications, on top of all of these qualifications and and experience, she is married with 2 kids. So, this is just a brief summary of who our guest is. She is, I don't know what to say, she is an embodiment of knowledge. She is blessed, and in fact, she's rounded. Basically, that's the word. She's rounded. So you're here with me. Don't feel like, oh, who has she got? With this resume, with this CV, with what I've just said about our guest, you can be assured that your questions are going to be answered from all sides, from experience, from knowledge, from every area. So without further ado, I'm just going to say, Madam, Dr. Loretta, thank you so much for coming to this show, because it's a blessing to actually have you here. So God bless you for coming. I know that you're ready to answer all our questions. So can we start, Ma? Or you want to say something?
Yeah. Thank you very much. Thank you, Precious. When we were reading that a while ago, I was wondering who is she talking about? Is it me or is it someone else? I don't really like titles and all of that, but I want to say God bless you. What you are doing for humanity, what you are doing for mankind. God bless you.
Thank you. God bless you too for coming. Thank you so much for finding the time to come. And I know that you're the best person, honestly. When I was looking for someone to actually come talk about women's health, I actually did contact other doctors, but at the end of the day, I thought, okay, I need to message Dr. Loretta, and she honestly responded. So I just thought that this is God, honestly. This it can only be God to respond to my message and accept coming. God bless you, man. So without further ado, guys, I just want you guys to please share. I want you to also put down your comments on the comment section, or your questions. If you've got any questions while we are talking, put on the comment section. If you have any view, any contribution, put on the comment section as well while we start. So we're going to start, Ma, with the first question. How can women proactively look after themselves to avoid or reduce the chances of having heart disease, high blood pressure, and diabetes? That's my first question, Ma.
That's a good question to set the ball rolling, Precious. The answer to that question is simple. It is women taking care of themselves. So it starts from you. And when I say you, it's a holistic you. And let's break it down. So let's say the psychological, which is your mind, and the physical, which is your body, which you see. So the psychological is what I'll take first. You need to start from your mind. You need to value yourself. You need to make out time for you. This may sound simple, but find out that we don't do it. You see women rushing all about the place, taking care of everybody else but themselves. That fraction of an hour that you need to sit down every day and just say, this is me, having my quiet moment and reflecting, many of us don't have it. The other thing is, we often think other people are responsible for our happiness apart from us. So you see women saying, oh, my husband is not helping me. He's not making me do this. He's not making me do that. Yes, we need help. We should use it, but we should know we are responsible for our own happiness. So go out there and do what you like doing. If you love skiing, go and do it. If you love going for outings, then do it, and make yourself happy. The next thing is, because that is very important for your mental health. The next thing is the physical health. How do you take care of your physical health? And again, it is you. You look in the mirror, what don't you like? If you don't like something, how are you going to change it? Most importantly, our bane as we get older is weight. And whether we like it or not, obesity is now our friend. It is a precursor. And when I say precursor, it means like foundation, like something that sets something in motion. It is a precursor for diabetes, a precursor for hypertension. It is even worse in those of us who are Black and ethnic minorities, because from the beginning, our vascularity and the nature of our blood vessels is such that we are prone to all of these problems like kidney failure, hypertension, and all of that. Add on weight gain, it doesn't help. So vegetables, you know what to do. Exercise, what suits you. Don't eat late at night. I mean, it's the gospel truth. We say it all the time. And don't you forget your water. Water, water, water. Thank you.
Wow. I think what Dr. Loretta has just said is that it's what we know. Basically what we know. But it's good that it's coming from the mouth of, she is not just an ordinary doctor, she is a specialized woman doctor. So I'm just using woman doctor. So you know that's where she's coming from, what the experience she has, and why she's saying what she's saying. So she's saying it from experience, she's saying it from seeing patients, she's saying it from a lot of things. So she is a woman doctor, she's a gynecologist. So basically, drink water, eat your vegetable, exercise, do the little things that are not really important, we don't see as important, but actually they are very, very important. Thank you so much. We're going to go to the next question because we have a lot to cover. And the next section is we're going to talk about fertility and contraception. Contraception, like I discussed with her some time ago, is something that personally has affected me. And from my videos that I've made on YouTube, so many people have also messaged me to say that after they've gone off contraception, a lot of things has happened. So, ma, can contraception actually affect fertility? That's the first question. And adding it to this question, I'm just going to ask: is there any link of contraception to having cancer? Because we've had so many rumors, but it would be good for a doctor, a woman doctor, to actually explain to us. Those are my questions, ma.
All right, thank you. Contraception and fertility. And you want to know if
It affects fertility.
contraception can cause some infertility.
Mm.
Okay. The truth is that there are very many different types of contraceptives. You have the pills, which people take in. And then you have the long-acting reversible contraceptive measures. We call them LAC for short. Those are where you have the IUCDs. By that, you mean the intrauterine devices. You have the implants. And then, of course, you have the Mirena, the intrauterine system as well. Then you have the permanent fertility control method, which are the sterilization, where we cut or block the tubes. And in males, you have the vasectomy. Now, if I go back, I want people to think properly and get this thing on board. If you take anything away from here today, it should be this: that contraception and fertility or infertility is not one person's problem. It's not a woman's problem. It's a couple's problem. It's a couple's burden. Or I don't like to use the word disease, but it's a couple's, if it's infertility, then it's a couple's disease, okay? Or a couple's disorder. It is not one person's problem. Because what I find women run from pillar to post, wanting to obtain contraception or wanting to become, to overcome infertility. So I think it's teamwork. Although there are special cases where, yes, it may just have to be a solo flight, and I will talk about that as well. But for the generality of cases, let's take it as teamwork. because that is when the other party will understand what's going on. And I'll give an example to buttress my point. So, in terms of contraception, you have to sit down carefully with your healthcare provider and find out what works for you. You have what we call the combined oral contraceptive pills, where you have a combination of progesterone, which is the main circulating hormone in pregnancy, and estrogen, which is the main circulating hormone in a woman who is not yet pregnant. Then you also have the progesterone only pills, which is just the made up of the hormone of pregnancy, synthesized hormone of pregnancy only. Then, like I've said, you have the long-acting reversible ones as well. Now, all of these things are different and they all work through different measures. You find that the pills, the combined oral contraceptive pills, actually try to mimic your cycle and create that balance. And then the progesterone also, the pills, they go and they tell the body, you're pregnant, don't release any egg, don't do any of these. And you need to know basic things about a patient before you just start dishing out contraception. One, how old are they? It sounds trivial, but it's very important. How many children have they had? How are their menstrual cycles? Is it heavy? Is it light? What is their gynecological history? Do they have things like fibroids or don't they? Do they have things like endometriosis? Endometriosis is when you have the lining of the womb anywhere else in the pelvis or in the body, and it can cause a lot of pain during periods for these women. When you've looked at all of these, you then ask yourself, have they completed their family size? If not, do they want to have any more children? Now, the baseline answer to your question, does contraceptive cause infertility? The answer there is actually no. It doesn't cause infertility. And the truth is that it should not delay a return to fertility. However, there are some sort of contraception that may have a time lag in the system. For instance, something like Depo, which is common in the African countries and in Nigeria as well, and women use it here as well in the UK. Every 3 months, you take an injection. Now, you have to be careful with that kind of contraceptive, and it has to be appropriate for you. If you have taken Depo and then you don't take it and you expect to get pregnant, remember that there's a 3 month time frame for it to work. So don't expect to get pregnant the next month if you change your mind on it. So that may actually cause a phase. Because what I find that some women, they take a contraception, and all of a sudden, maybe their partner says, oh, I'm now ready to have children. And they took that contraception last month. They're like, oh, I want children. And they're running from pillar to post, forgetting that that actually works for a while. And in terms of Depo, it may even span a bit more than 3 months, up until 6 months. Or ideally, no contraceptive is supposed to negate your fertility at all. The copper IUCD, which is insertable from down below, is one that it has no hormones in it at all. It is completely hormone free. It works with being in position and having copper wound around it. So when women come and each of us tell us, because we swap stories, we'll say, oh, I was on progesterone only pills and the doctor gave it to me. And you hear it and you think, oh, I'll go and buy progesterone only pills. But you've not asked yourself why. Perhaps that your friend just had a baby and is still breastfeeding, and we've thought, okay, that is what is suitable for her, progesterone only pills. Or your friend is over 40 and we don't want 45 and we don't want the combined oral contraceptive pills. So we don't want that. So there are different things that would determine the kind of contraceptive that a woman is given. There is the unspoken rule about the insertable ones from down below. If a woman hasn't had any child at all, sometimes it can make it a bit difficult to get it through the neck of the womb. Furthermore, if a woman is single, it will not be my go-to choice immediately, except there is something else happening in that woman, i.e., if she's got endometriosis and I want to treat it locally with the Mirena IUS, then I may think of that. But the reason I would not want to, or if she's vulnerable, i.e., some of us may have learning difficulties and they are vulnerable to being abused and having unwanted pregnancy, you may want to put a copper in there. But you must realize that in a single lady, she's likely to have multiple sexual partners along the line. Plus, she's probably not had any child yet. You don't want to go and put something that has got threads that come right into the vagina, into someone who may be prone to having different partners, because that increases the risk of having STIs just track up. So these are some of these subtle, unsaid rules. And this is why you must go and see your own practitioner to review you. If you have very heavy periods, copper is not necessarily for you. But the Mirena IUS can eventually take away the bleeding, and women may not have any periods thereafter. The key thing is to bear with any kind of contraception you start with. So have a phase where it sits in well with you. And that is usually between 3 to 6 months. If it doesn't sit in well with you at that time, then you can go back and discard it and get another one after being thoroughly checked by your healthcare provider. Now, with respect to cancers, contraceptives, there's been that myth, but contraceptives they don't predispose to cancers per se. I know that a woman confronted me once and said, "Oh, I have a lot of cysts. It's because I was on the pills and because I had Mirena." I say, yes, sometimes in literature it's documented that progesterone, the pills, can make you prone to having cysts. But that in itself is a benign condition and it's not cancer. And then there was this slim chance of breast cancer with the pills, but the chance is very, very slim. And it's actually even protective for ovarian cancer. Um, so it doesn't. But the key thing is see a healthcare provider, let them assess, tell them the truth. Precious Derrick, some of us have migrated to England on papers that have ages that are not compatible with our biological age.
True.
So if you're reading 30 and you're actually 45 or 40, tell them the truth. Tell them your proper biological age, and then let them factor all of these into the provision of your contraceptive measure. Discuss it with your partner. And I'll use an example to end this up. A woman came and had a copper coil fitted. At the time, this was in Nigeria. She had had a fair number of children and she was just tired, but her husband wasn't keen on the contraception. So she had the copper fitted. She didn't tell her husband. And then the man started complaining that during intercourse, he was feeling something hurting him, you know? And he was becoming very paranoid and asking the woman, is there no razor blade in there or something in there, you know? And then it was at that point she then said, oh, sorry, I went and I fitted the copper. To cut a long story short, she did come back to the health service center and we just cut the threads a bit shorter because that can happen with the copper IUCD or the Mirena. But the initial trouble and quarrel that happened in the home may have been averted if she had told the man, I was going to get or I am going to get contraception. Even if he disagrees, still tell him that you are going to get the contraception. Because at the end of the day, it's your body. You are the one who's probably going to die from postpartum hemorrhage, which is bleeding children, and he ends up marrying another wife, not you who is in the grave already. So
Mm.
I suppose this answers our question to a fair point. And I want to encourage men that you can always help your women. If you think you've completed your family size, there's nothing that stops a man from having vasectomy. It doesn't stop your it doesn't stop your performance. Some people say, "Oh, I will not be able to sexually perform." No, 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 no. It doesn't cause erectile dysfunction. It's a way of helping the women as well, because some of these things, they contain hormones. Tomorrow you come and say, "Why are you so fat? You're so fat. You're not losing weight." It's probably sometimes that's a known side effect of a lot of the contraceptives, because they contain hormones that can cause water retention. So sometimes you need to help these women as well. Don't just stay in your own comfort zone. I can see Precious, you are laughing saying this. You're almost like, which men will go and do this? But some men do, and kudos to those men. I clap for them today. And I've seen them, okay? I'm just encouraging others to also think about it.
Thank you so much. Honestly, if there's anything you said that has just stuck in my head is, and which I would want to just talk a little bit about before I go to the next question, is that women sometimes we carry a lot of responsibility, we carry a lot of load that is supposed to be shared. It's supposed to be between the husband and the wife. Because imagine a load that has been shared by two people. It becomes a little bit lighter, isn't it? But when you carry all this load, when we carry all this load, it becomes so heavy. When it comes to fertility, when it comes to having kids, women tend to be solely responsible for having children. It's my responsibility. If the pregnancy is not coming, it's my fault. Anything that's going wrong is the woman's fault. But honestly, women, and I don't know, the people that are watching, people that are going to watch later, it is not your responsibility alone when it comes to even contraception. Like our own doctor has said, it's not coming from me, that is just a layman. She has said it that contraception should not just be the woman thing. Actually, if a man gets this vasectomy, it actually helps a lot more, because we won't have to introduce these foreign things in our body, because the man has just taken the responsibility. But God help us anyway. Why I was laughing was because from where we're coming from, you mentioning, can you go have vasectomy? It's like, where you come, what is that about? So you can't even mention it in the house, but things are changing, and I hope that our men will begin to change from everything
And
going on. I just,
And just to add, I know I've spoken about routine contraception, and
mm,
I've talking about male vasectomy as well. But we shouldn't forget that there's also female sterilization. And if you've completed your family, I mean, there are women who have had 2, 3 C-sections, and they say, at this third C-section, please just tie my tubes. Or women who've had 3, 4 children, they come back and they have a female sterilization. So that's also an option there that you could explore. But I just want to touch on emergency contraception. Let's remember that that also exists, and you can meet your healthcare provider. You can have the morning after pills, or in some cases, we could put in the copper device, depending on what's happened and what the patient is all about.
oh wow, thank you so much. So we're going to quickly go to the next question. Please, if you're watching this alone and you have not shared this video, you haven't shared the link, it's not fair. You're being a little bit selfish. Please share, share, share. Everyone needs to hear this. It's not just about a women something. Men need to hear it as well. They need to
Oh,
be able to
yes.
support as much as possible, because we're going to be going on the other section, which is menopause, which I even think all men should be listening, because it's an area that, in fact, let's not go there. So let's go to the next question. Can you briefly talk about polycystic ovary? This is just in line with we talking about fertility and
Oh, yes.
infertility. Can you
Oh,
talk about
yes.
polycystic ovary syndrome, God help me today,
Endometriosis.
endometriosis,
Yeah.
and uterine fibroid? Can you just talk a little bit about this so that whoever is
Okay,
hearing
so
will have it?
I'll start with polycystic ovaries. Polycystic ovary syndrome is where you have women um, having, like the name tells you, a lot of cysts within the ovaries, um, and they have most times they're on the obese side, and high levels of circulating estrogen and the male hormones as well. Now, let me try and break this down. Let me make it very simple. Every month, our body, in a woman, the ovary releases an egg. So one ovary may decide to release one egg, or the both ovaries can release two eggs at the same time, in which case we have non-identical twins. But the story is your body starts to get ready, preparing this egg in the ovary, and as it's doing it, it's releasing some hormones, the hormone of the non-pregnant woman called estrogen. It just keeps releasing it into circulation. It reaches a point where that ovary preparing, let's say cooking that egg, it's cooked and then it pops out. That is when you ovulate. So it pops out and it's looking for a sperm to fertilize it. And when there is no sperm fertilizing it, everything begins to break down. And at the end of the month, the lining of the womb, which built up to receive a fertilized egg, then sheds as menstruation. So this happens every month, every 28 days. Now, what happens in polycystic ovaries is that instead of one egg wanting to be released, a lot of small follicles just start wanting to release their own eggs. So there are very many, all preparing that they want to release an egg. They keep secreting estrogen into the system. And what happens is that those levels of estrogen are so high that they don't trigger the needed feedback to release any egg. So you just find that the lining of the womb just keeps building up, building up, building up. And all these small follicles are there in the ovary. That's what you call the cysts, because they are water filled, just wanting to release an egg that is never released. So that's polycystic ovary. And then you then find that this will result in high circulating levels of estrogen, what we call the sex hormone binding globulin. All of them are raised. The male hormone is synthesized in the fat tissue because estrogen will now start converting all of converting in the fat tissues, within the fat tissues, it will start a process of conversion that increases the circulating male hormone, testosterone. So what you then find is that these women start to have a lot of hair on their body. Hirsutism is one of the symptoms of polycystic ovaries. They have beards, they have hair on the chest. And because no egg is actually released, the fallout is subfertility, because no egg is actually released. And then you find that sometimes there can be voice changes as well. So in terms of polycystic ovaries, if you just as much as work hard to lose weight, you take away the manufacturing industry where that male hormone is produced by your own excess female hormone that is high in circulation. So you find that when people lose weight, they correct that PCOS syndrome. And sometimes we can go in and say, let's hasten it and use medications like metformin to help treat this condition. And also sometimes it can be surgically managed, in which case you go in and you pop all of those cysts on the ovary. It has a very scary name, ovarian drilling, but it's not really using a drill. You just go there and you pop all of them, and that helps. But for you to make that diagnosis of polycystic ovaries, a woman must first have an ultrasound scan, as you would imagine if I've explained it, to look at the ovaries. You want to see the number of that are there, and then we need to do blood tests to look at the levels of circulating hormones. So that is it for polycystic ovaries. And yes, it can actually cause subfertility. So see a proper gynecologist if you suspect. And one of the things that women come with, they'll say, oh, I'm not having regular periods. My periods come once every 6 months, once every 3 months. So it's important that you see your gynecologist, and they will determine how to treat you based on how old you are and what is your most bothersome problem. If it's the hair on the body, there's a way to treat that. the periods. We try to make sure a woman has a period at least every 3 months. And one of the basic ways of treating that sometimes is to give just the simple combined oral contraceptives. The reason is if you let the womb just be bombarded by that hormone of women called estrogen for a long time, all the time just bombarded, it can cause, it increases the risk of cancer in later life, womb cancer. So it's important that we get the womb to shed periodically. And also, when we are pregnant, it is important we give this history of polycystic ovaries if we have it, because it can also predispose us to diabetes in pregnancy. So polycystic ovaries is not a death sentence. It goes back to what I said when we started. Exercise, keeping your body mass index, keeping your weight down is something that can just help you even tackle PCOS. But yes, it is linked with subfertility, and yes, it can be managed depending on what is your most pressing symptom.
Yeah. The next one is the other one, endometriosis.
Endometriosis. Now,
Yeah.
endometriosis, let me try and explain it in very simple words. It is when, okay, Precious and my listeners, just imagine that you have a lining of the womb. The lining of the womb is somewhere else apart from inside of the womb where it's meant to be. The womb is shaped like a pear upside down, or if you like, turn a cup upside down. I wish I had a cup here. But importantly, it has special lining within it. Those special linings respond to the hormones every month, and they build, waiting for that famous pregnancy that never comes or that comes. If it doesn't come, they shed again as the blood you see at menstruation, and the whole cycle starts again. So it's nice because it's inside that container, upside down, pear-shaped container called the womb. Now, imagine that that lining inside that womb is somewhere else. Maybe it's in the ovary, in which case it's still in the pelvis. Maybe it's inside the muscle of the womb, or maybe it's somewhere on the fallopian tube. Now, just think about it. Every month, you now have a period, and that tissue that was supposed to be inside the womb is in all those other places. When the womb is shedding and bleeding, it is also shedding and bleeding into those tight spaces. What will happen? Pain will happen. In some cases, we've seen extrapelvic endometriosis. That means it's not even if this lining of the womb is in far places, maybe sometimes on the bowel, on the bladder, or on the rectum, or in rare cases, the one I've read about that really surprised me, on the palm. The woman actually said, every month, my palm goes red and painful. And then in some cases, in women that have had cesarean section, it may be somewhere on the cesarean scar. But what gives endometriosis away is the cyclical nature of the pain. When it starts, every month, you just notice that you have pain. Sometimes some women don't attribute it to their menstrual cycle. They don't even know. They are not, observant enough. So the first thing we do in the hospital is to give you a menstrual diary and say, chart this pain. Tell us when it is worse. Tell us when it's better. And most times when you come with your diary, you just see that the days you have pain is coinciding with the days just before your period starts. It's very bad during the periods, and it starts to get a bit better after the periods. So that is endometriosis. And how do you manage it? Since I've told you how it starts, you can just think now that to manage it is to stop the period. Does that make sense? So when you stop the period, it just goes. Now, well, how do you stop the period? Nature can stop the period when you get pregnant. So you see that in pregnancy, women with endometriosis don't have symptoms. It can be so painful and bad that it can cause pain during sexual intercourse. especially if it's in areas that that can be sort of have some sort of indirect contact or during sexual intercourse. And if I then decide that I want to stop a woman's period, it depends on the point in time in that woman's life. If a woman is trying for pregnancy, I can't say I want to stop her period. So you see why it's very interesting being a doctor of women, both pregnant and non-pregnant, because you have to engage with them. You have to know their history. One way to manage endometriosis is to give the combined oral contraceptive pills to some women, and that understandably can help. You go on and you then say sometimes, okay, let's give Depo-Provera, progesterone only, take away the periods. And that can help. In some cases, we just put Mirena in. Mirena helps to liberate the hormone of pregnancy locally to just the womb and the surrounding areas. And that can help with the pain as well. In extreme cases, we just go and control the brain. We give what we call gonadotrophin releasing hormone analogs. So those are medications that will go and tell the whole body and say, hey, go into an artificial menopause, no periods. And the women will come and tell you, I feel so happy. My quality of life has changed. There is no pain. But the downside is that it could bring on menopausal symptoms. So sometimes we give them what we call add back estrogen to stop the hot flushes and all of that.
Yeah.
But by and large, endometriosis is something that even in our culture, we need to take as a Black and ethnic minority person. I think we need to take it more seriously. Because you go to your mom and you say, I'm having pain. And say, hey, go away, you're a woman now. That's why you're a woman. The pain can be so intense. And it can take an average of 5 years to make a diagnosis from when a woman first steps in the hospital with this kind of pain, some cases.
Wow.
And
Wow.
don't forget that the cesarean scar one is also there after people have had cesarean sections. It can be there. So when you have a swelling in your body that is cyclical, comes monthly, please think endometriosis. It doesn't matter where it may be. Now, if we go on to surgical intervention, sometimes we can go in surgically, keyhole, and actually apply some temperature to the endometriosis, depending on if it's deep or superficial, or cut out some of the place where it has caused some scarring or where it is. Yeah. And obviously,
Yeah.
there are other surgical methods that can be a bit more
Wow.
radical.
Wow.
But that
Thank
depends
you.
on where it is. Depends on
Yeah.
where it is, precious. If it's on your bowel or your bladder, we don't want to go cutting those. So there are some other methods we could use.
Yeah.
And then
Um.
fibroids was the next
Yeah.
one.
Fibroid. Quickly, if you don't mind, just very quickly. Fibroid.
So be very quick about fibroids. Fibroids are benign. When I say benign, they are not malignant. That means they are not because when people hear tumors, they just go, cancer, cancer.
Cancer.
But fibroids are benign tumors. They can be called leiomyoma. They are like, think about them like onions. They form whorls, they are secular and they grow in the womb. Why do they grow? They are fed by the hormone of a non-pregnancy state, the hormone that happens in us women daily, estrogen. That's what feeds them. And fibroids have a predisposition for the Black woman. 3 out of 5 Black women will probably have fibroids. And fibroids can exist in women and just cause no problems, no symptoms. So one of the main things is that there are incidental findings. Maybe you go for something else and then they'll see a fibroid. But remember that they grow in a non-pregnancy state. So if we stay for a long time, in fact, there used to be a joke that a womb that doesn't carry babies will carry fibroids. The hormone estrogen, we keep feeding a small, tiny seedling of a fibroid and it keeps growing, growing, growing and gets bigger. It can be inside the womb, floating. It can be in the muscle of the womb, or it can be on the covering on the outside of the womb. Okay, those are some of its locations. It can be one, can be two, it can be many, can be one big one. And they can be treated either medically sometimes, or it can be treated surgically, depending on what is peculiar to that woman. And yes, it could affect fertility based on where it is. It can cause very heavy periods, and it can affect your choice of contraception as well. So that's a short snippet on fibroids, but it doesn't necessarily kill. However, sometimes the adverse effects of having very huge fibroids can be life-threatening, because imagine if it's so big and it obstructs blood supply, it's pressing on the bladder or other things. So it's important that as women, we try and get our children early. We try, you can't force yourself, um, but and also shorten the gap or intervals if you can manage it between childbearing.
Wow. Thank you so much for this. I guess if you're not a doctor, at least you have an idea what these three, I'm not going to pronounce it if that's what you're waiting for. I'm not going to pronounce it. That's what is.
Endometriosis is the one that like it.
So I guess if you're not a doctor, at least you have an idea what PCOS is and the endro and
Yeah,
the
try to keep
fibroid.
it simple.
Yeah,
Yeah.
yeah. So you just have an idea. It's not a death sentence, but you have to look after yourself. That's
No,
basically
it's not a death
what you
sentence. It's
at
important.
all.
I have had fibroids and I'm very alive. So it's not a death
Yeah.
sentence.
So that's the main thing. So we're going to quickly go on to the next question, but please, on the comment section, if you have any question at all, this is an opportunity for you to ask a live gynecologist to answer you, because if you want someone to answer you that question, you have to pay. You have to go to your GP, book an appointment, or you have to go. If you're in the US, you know how expensive that is. So this is an opportunity for you to ask your question. If you don't want to ask you on the comment section, you can message me privately if you have my details, either on Facebook, Instagram, or direct number. You can message me privately, and I'm going to ask the question anonymously for you. Okay, so moving on, we're going to talk about cancer, right? On this topic, we're not going to talk too much about cancer, but we just want our doctor to let us know the things we should be looking out for, and the type of cancer that people don't really think about but do really exist and affects women a lot. Carry on,
Thank
ma.
you very much. Precious. Um, to our viewers out there, before this show, myself and Precious were just talking, and obviously time is also fast. And we're talking about cancers. We know that cancers are rapidly dividing cells. That's what tumors are. They just, for some strange reason, they just get a signal. I don't want to use all those big words though. And the signal just tells them start dividing rapidly, and they just start dividing and overtaking every other cell, consuming all the blood supply. It's so parasitic and sort of it's something that we don't want to see. Okay. But then they do exist. And I was just saying to her that people are very familiar with breast cancer, cervical cancer, and the screening and all of that. But one thing I found, especially in the Black and ethnic minority communities here as well, and also from back home in Nigeria, is that people don't really, really think about womb cancers. And I think this came to light recently when a woman who is a friend of my mother actually said she was 54. She hadn't seen periods for about 4 years. And then all of a sudden, she was having periods again. And she was very excited and said, oh, she's very happy. It means she's now young again. She's having her periods again. And immediately I told my mom, I said, that is a warning sign. If a woman has not seen her periods for a year and she's not on any hormonal treatment or any contraception, that is termed that she has attained the menopause. The age varies from woman to woman. And if after that interval, you now have something as small as a tiny drop of blood, one drop from the vagina, it is an emergency that needs to be checked. It
Hmm.
may be nothing, but it could be a sign of womb cancer. And womb cancer can be common in persons who've never had children, persons who are obese, weight gain again has come in, persons who are diabetic, and persons who have had prolonged untreated polycystic ovary syndrome, polycystic ovarian syndrome. So you can see that these things are all linked and they've come back to stay at us again. So if that happens to any of us, please, please, please go to your gynecologist, not just any other doctor. Don't go to an ENT doctor. I mean, in advanced countries, the specialists are quite clear. The GP will send you to your gynecologist when they know that it's a gynae problem. But in other countries, you have one doctor who may be in another specialty, catering for other specialties, and that's not right. Let us be health aware. Let's improve our health seeking behavior. Go to a gynecologist. With respect to ovarian cancers, people may come to you and they say, oh, I feel bloated. My tummy is swelling up. Ovarian cancers are often termed silent cancers because they don't really give any symptom. And by the time you are having all those feelings, it may be too gone. So that means that if you have this feeling of, oh, I get full easily, my tummy is often flooded with gas, and all of that, please seek out your gynecologist as well. Importantly, if you have a family history of any of these cancers, seek help quickly because some of them are inherited. And in some countries across the world, we are not able to investigate if the person actually carries the gene or not.
Wow.
An ultrasound scan will be requested in most of these cases, and the ovaries are looked at, the womb are looked at. In womb cancer, we look at the thickness of the womb and match it with, are you ovulating or still having a period or not? What age are you? In ovarian cancer, we'll look to see if there's anything in the ovaries. We'll look. So these images are available. We tie them up with blood tests and we arrive at a conclusion. Breast cancer is something almost every woman is now familiar with. You know, people should go for their breast screening, depending on which country you are in. There are places where they start from the age of 45 to do the mammograms. There are places where if you come with your symptoms, they will do the fine needle aspiration, take a little sample, or ask for an ultrasound, do the mammograms and all of that. So you have to be breast aware, check every month just after your periods, and know your body. I think that's the summary. Know
Hmm.
your body. And if something is out of sync, seek help.
Wow. Thank you so much. I'm just going to read a few comments on the comment section. John Advisor said copper with an emoji like us thinking. Obwagu Miracle said, how is the female sterilization done? You're gonna answer that question just after I finish reading the comments. Influence Wadu said, wow, great details on PCOS. And Miracle said again, wow, interesting. Vicentia said, great explanation. Then another question from Miracle said, what is the best spacing age for giving birth? So can you please answer both questions? What is female sterilization, or how is female sterilization done? And what is the best spacing age for giving birth?
Okay, so female sterilization um, is simple. Think of the womb as a receiver, and what leads to the receiver? You have two tubes on either side. So those two tubes, they go to the ovaries. Those two tubes are the passage where the egg, when it's released, will come and float towards the womb. And don't forget that at intercourse, the seminal fluid that contains excuse me, please, that contains the sperm is released. Um, the sperm will float through the cervix, floats, and its intention is to go and meet an egg and fertilize it. Now, what we do at female sterilization is to, one, put a clip. They're called Filshie clips, those tubes, to block the pathway of the egg from meeting up with the sperm. And it's really simple. If it's done um, when the woman is not pregnant, it can be done keyhole where you put, and you just have maybe like two holes on the abdomen, one in the umbilical bottom region, and the other maybe just over the suprapubic area or a bit to the left. So it depends on the surgeon. It depends on if you've had sections before as well. So it's really quite simple and it's a permanent form of fertility control. It has a 1 in 200 lifetime. Mark my word, lifetime. So if 200 women do it in their lifetime, only one will fail. So it's permanent. And if reversed, it's fraught with a lot of problems, one of which is the risk of ectopics. And it's even very difficult to reverse. So you must be sure. You know, like when you do Who Wants to Be a Millionaire, final answer, do you
Mm.
want female sterilization? So that's it. As cesarean sections, quite easy to do. We just tie up the tube and then cut it off and ensure that that's bilateral tubal ligation at cesarean section. So that's how it's done. It can be keyhole, but if at section a woman has had various section or a woman has said, I want sterilization, you must give your consent before a cesarean section. It's not done in emergencies because you have to think about it carefully.
Mm.
Yeah.
Before you do
Then
it,
the
yeah.
other question that says, what is the optimal spacing in between children? I just want to say here that that is individualized. That is for you, to decide. Your circumstance will predispose to that. But
Mm.
the truth is, if you want to learn from my own experience, I'll tell you. My two children are 5 years apart in age, and I discovered just watching them that they cannot just spontaneously play together. My daughter has to decide that, okay, I want to play with my younger brother because the age gap, they are interested in different things.
Mm.
And when they were growing up, they were never quite in the same class. So this one could not hand any books or anything over to the other one. And in terms of getting carers for them, it was quite challenging because they were in just different spheres. But I think the advantage is my daughter is very well grown and she can take care of the younger one. And in terms of health, the disadvantage for me then was because I had fibroids, there was a long time for the fibroids to grow bigger because of the long child spacing interval.
Mm.
So it's for you to strike your balance and you know what it is that you want from life. But I, from my experience, would advocate that 2 years is just okay. If you've had cesarean section as well, please do not get pregnant anything earlier than 2 years. I know they said the space from delivering to delivering the next one should be 2 years, but I would say from my experience that just try and wait for 2 years before you get pregnant.
Can you explain a little bit why? We know
The
why,
reason, the
obviously, but
reason
just
is the reason is you want to give that cesarean section scar time to heal.
you.
You don't you don't want to go running in when the body has not fully healed and you want to stretch the womb again with another pregnancy. You could have a 1 in 200 chance of scar rupture or scar dehiscence at that time.
Yeah, just following up with what you've just said, I've just got a tiny question which is not on my list. You know, when someone has had a child through cesarean section, is it always true that that person is likely going to have cesarean section for the rest pregnancy, or it's
No,
just
no, 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 no,
right?
no. Please, if you've had one cesarean section, it depends on why the first cesarean section happened. Please, let me use this opportunity to tell our women today that each of us is fearfully and wonderfully made. And please, even when you swap tails, know that you are special and you are unique. What happened to Precious may not happen to you. What even happens to Precious in one pregnancy will not happen to Precious again in the next
Another one.
pregnancy. So
Mm-hmm.
everything is unique. So depending on why you had the section, how far you went before you had the section. So let me give you an example. If a woman had a section, maybe she was already 9 centimeters dilated, and then she had a section because the baby heart rate was dropping. Next time, she can go and try for a vaginal birth with very good chances. You know, it's different from if a woman had a section at 1 cm dilatation and she was there in labor for days. We had used the hormone drip. She still didn't progress. Now, those two scenarios are different.
Different.
Okay. Secondly, the weight of the baby. Other things may contribute. Were there fibroids in the first pregnancy, or are there now fibroids in this second pregnancy? Where is the position of the fibroid? Where are they? I mean, in advanced countries, it's good because people do scans and they know all of these things. But just to say that generally, you have a 75% to 80% chance of having a successful vaginal birth after a cesarean section. So if you had one C-section, you have that chance. And if maybe you had a normal delivery, then for some reason you had a C-section in the middle, and now you are pregnant again, you even have an even greater chance of having a nice normal delivery. But what I don't want women to take away from here today is to say, oh, Loretta said I have a nice chance of having a vaginal delivery. Then when you are pregnant in labor tomorrow and your doctor says, oh, I think a C-section will be better, you'll be hanging on. No, let your clinicians make your judgments and let them make it in a holistic manner and determine what is good for you. But by and large, having one section is not a condemnation to sections for life.
Absolutely, absolutely. Thank you so much. Just in line with what Dr. Loretta just said, I'm just going to say something which is a bit personal to me, which I think might benefit a lot of people. Whenever I'm pregnant or whenever am in that season of pregnancy, I am very, very open. I am not one of those people who, when I'm pregnant, I say, oh, I'm going to have a vaginal delivery. Yes, that is what I am going to have. Whether the doctors like it or not, that is what I'm going to have. I am not one of those people. And I think maybe if you're watching, you may benefit from it. Have an open heart. All I want is the healthy baby, and I am healthy. If the baby is going to come out through vagina, praise the Lord. If the baby is going to come out through anywhere, praise the Lord. At the end of the day, the baby is healthy, the mother is healthy. Because one of the problems we have for people that are coming from Africa is the fact that people that go through this cesarean section, I don't know if they see them as people that don't have the ability to push a baby. To be honest, there's no award given to women who have vaginal delivery. Okay, so at the end of the day, what should be important to you, what should be important to your family is you are healthy, your baby is healthy. So when you're pregnant or the next pregnancy you're going on, I will advise you that have an open heart. Whatever your doctor or your gynecologist says to you, accept that this person is experienced, knows better than me, and wants the best for me. So don't, yeah, obviously the Bible said the just shall live by faith, but be careful when you're living by faith because that faith may not actually be you doing the right thing, it may be you doing the wrong thing. So I just said I would drop this here as we're talking about this. So moving on, I don't know if you agree with me, Dr. Loretta, what
You
I've
see,
just said.
I do agree with you, but I want to stress, and I want to stress significantly. Someone is asking for the link for this program, so I'm just sending it
Okay,
to them.
that's fine.
Um, I want to stress and say that decisions about a woman's health, decisions about pregnancy, mode of delivery, decisions in labor, decisions antenatally, and decisions having had the infant postpartum should be joint decisions with your healthcare providers. And once again, I will stress that you please give all the right information. And then they can help you make an informed decision. They
Decision.
don't make your decisions for you. You've got your autonomy, but they will help you come to an informed decision that will keep you safe if it's just gynecology, or that will keep you and your baby safe if it's obstetrics. So it's important, women. It is not, I find that some women will say, oh, let me ask my mother-in-law first. Oh, I went to Nigeria some time back, and a woman needed a cesarean section. And we were telling her, and she said, oh, my husband needs to come and sign. Okay, where is your husband? He's in the creek. He's an oil worker offshore.
Mm, mm,
And I looked at the doctor, and the doctor looked at me and he said, welcome to our world. And I said, well, I go to Nigeria quite often. For those who know me, I'm there in out, in out. And I said, but these are some of the cultural stereotypes we need to start changing. Even
mm-hmm,
here in the United Kingdom, I had a Black and ethnic minority couple come in to have a child. First of all, their whole church came onto that labor ward and were praying that it should be a male child because the woman had
mm,
had, I think, 4 C-sections and they were all
mm,
girls.
yes,
And I was really, really upset that they were. I told her, I said, you are bringing down the rep of my country, you know, coming to do this kind of thing, you know, coming with the full church members to come and be praying on labor ward that a boy should be converted from the girl that they've
mm,
told you it is because you've had.
already. Mm-hmm,
And then when it was time to section her, she said no. The husband said no. And this woman, mind you, had had 4 previous sections. The reason they said, oh, it's because they didn't think the first 4 sections were necessary. They think the doctors here are not patient. If she was at home, she would probably have delivered like the Hebrew woman.
mm,
And at this 4th time now, they were not going to have a section. Anyway, to cut the
mm,
long and short of it, she ended up having a section. She lost so much blood. She was transfused over six units of blood and all the other
mm,
accompanying FFP and the rest. And I came the next morning and I got onto labor ward. The first thing the midwives told me is that, oh, we had a Nigerian drama on labor ward yesterday. And I was so,
wow,
so not happy.
embarrassing.
So please, let's take all of these away. Every woman is individualized. Make your decision holistically and in factoring in your own past medical history, your own previous obstetric history with your care provider. Please.
Thank you. Thank you so, so much. Thank you so, so, so very, very much. We're going to go on to the next question. And before we go on to the next question, I just want to acknowledge people that are watching. Faith Obi said, good. Thank you so much for joining us. Miracle, thank you so much. Anu Onimole, thank you so much. I just want to say thank you to all of you. Ruben, and thank you so much. Chefin, thank you so much. Thank you so, so much, everyone that's watching, all of you dropping your comments, your contribution. One thing about women is that I love it. I'm so, so passionate about women because I know that we like to learn, we love to listen. We just want to get the best information. Please, if you have not shared this video, please share, share, share. Let's get as many people as possible to watch. If you have not subscribed to this YouTube channel, I don't know what you're waiting for because there's a lot of things lined up that I always like to get like practical topics. I always like to get things that will benefit all of us, including me. So please subscribe so whenever I'm live, whenever I do something like this, you'll be able to get notification. Moving on to the next question. You know me very well. If I don't talk about sex, then know that Precious, something is wrong with Precious. So we're going to talk about sex from a doctor's perspective, and because obviously we can't just talk about sex in the other side of it. We're talking to a doctor now, a woman doctor, so she needs to help us in the area of sex. Why do people have pain during sex, and what might be the cause? And following that, I'm just adding this one. Why do some women not have the urge? They have that loss of libido. Why do they have that loss of libido when they don't have any medical condition or they just don't know what's wrong? But they find out that they don't have that sex drive to actually have sex when they want to have sex or when their partner wants them to have sex. That's my first question, man.
So Precious, I'm quite
Yes.
intrigued that, and I'm really impressed, and I really value it that a woman with your Black and ethnic minority background, you are very keen to talk about sex, and that reminds me
Absolutely.
of the song. Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things and the bad things. That baby. Let's talk about sex. See, I tell people, I said sex makes the world go round, okay? And it's ironic, but they said there are basic needs, 3 basic needs. food, shelter, sex is one of them.
Mm-hmm.
So we need to talk about it. But ironically, I find that I have come out of a culture where people don't want to talk about anything below the neck. And it's ironic. They don't want to talk about any of these things, yet they are doing it. And they even do it more than those who talk about it. There's a day, myself and Douglas is my husband, we're looking out of our window. And we saw, then we were in Scotland, we saw two people kissing at the bus stop. And Douglas said, these people have been kissing since at that bus stop. I said, yes, so they have, but you're surprised they probably not had sex. And then he started laughing. I said, why are you laughing? He said, well, in Nigeria, you won't see people kiss or even hold hands, but you see them having 7 children.
Mm-hmm.
How do they have it actually? How do they do it? And it's also interesting that you just see girls growing up. They're growing up. Their mother will say, don't let anybody touch you. If anybody touches you, you just get pregnant.
Get
Don't
pregnant.
let that happen. And this girl continues growing, growing, growing. She's 20, 25. Then all of a sudden at 26, they'll say, you're not married. Why are you not married? You've not brought man home. And I'm wondering where they're supposed to just jump from, don't touch anybody, and all of a sudden they just manifest and come home with a
Married.
man, and then they just start
Mm.
giving you grandchildren without having
Mm.
sex. So
Mm-hmm.
well done, Precious. Well done to
Thank
programs
you.
such as you are
Thank you.
breaking the stereotypes and
Thank
you
you
are
so much.
challenging the conventional stereotypical wisdom of certain cultures.
Thank you.
So well
Thank
done.
you so much.
Um,
Thank you.
pain during intercourse. Pain during intercourse or pain during sex can be caused by a whole range of factors, but it needs to be looked at in two ways. Is it primary pain? That means, has it always been the case since that woman first started having intercourse? Or is it something new? Is it secondary? Okay. So if it's primary, if it has always been like that, what could be causing it? If it is secondary, if it's something that started halfway through life, what could be what could be causing it? Pain is, we must remember that is a subjective assessment. So when I say subjective, I I can't really measure your pain, Precious, but you can tell
Mm.
me you have pain. Your threshold for pain may also be different from my threshold for pain. So it's a difficult area to navigate.
Mm-hmm.
However, the causes can either be psychological or physical. It may
Mm-hmm.
be that over time, some people have just put a roadblock to sex. Now, this may sound amazing to you, but we see it all the time. And if you explore well what may be in the background, it may be that one, they've even caught their partner cheating. They are very unhappy with that man. The moment he touches them, they recoil, they
Mm.
transmute it. It's pain. Two, a woman who has been raped before may be having post-traumatic stress disorder, you know, and this
Mm.
is huge, huge burden. It's not what anybody should laugh about, okay? And that could actually manifest as pain. Now, how many women are honest enough to tell their current partners or husbands that they've been raped? There are very few. I won't lie to you. I work with women. We are deep. We are deep people. Very, very few women will own up to a partner
Mm.
who wasn't there at the time and say, I have been raped before. So what I'm trying to say is that there are psychological causes for the pain, and then there are actual physical causes for the pain. Now, let's look at some of the physical causes. A woman who may have had procedures like female genital mutilation may have had Nigeria is good now. We don't do the extremes of FGM. Somalia, they will sew it back again, stitch it back, and leave only a pinhole. That's what I call it for menstrual blood. And I
Mm.
wonder how is when some of them come to me in clinic, I wonder how do these women even get pregnant? How will a penis pass through this tiny hole? That must be pain. Okay. So FGM of any sort, especially if it's extensive, or if the woman was infibulated, that means if it was stitched up again after that cut, can result in pain, because scar tissue is not necessarily the same as a tissue that was the same way God made it. You
Mm-hmm.
know, other things that could cause it is maybe after childbirth, if a woman has had an episiotomy as a cut to help the head come out and not make her tear, or if she has some very significant tears that were repaired and is repaired a bit too tightly, all of this could end up causing pain. Okay? Now, you need to examine the woman, take a good history, and find out what could be causing this pain. Endometriosis, I've talked about that, cause deep dyspareunia. That means deep pain, not at the surface, not superficially at entrance of the penis into the vagina, but deep during intercourse. Also, the position assumed can cause pain. When women come to me and say, I have pain, I ask them, do you have a new partner? Because unknown to some women, that could be because the size of the phallus that you've been having, the size of the penis that you've been used to may just have changed. It may be a lot bigger, and the man is not giving you time. There's not enough foreplay. There's not enough
Mm-hmm.
lubrication. He's not giving you time to adapt. And that doesn't help any woman. Men, please take note. There's no use carrying a big implement about and you don't know how to use it properly. You know, sexual pleasure does not depend on the size of the phallus, but rather it depends on the method of the operator. And like I told my lecturer who coined this phrase, and the operative. So women, you must be a part and parcel in terms of you enjoying sex. If you see
Mm-hmm.
that there are certain positions that cause you pain, you must tell your partner and he needs to compromise with you. And I'm telling you today that the doggy style, man behind, woman in front, can cause a lot of pain because it shortens the vagina and the penis is going to be hitting the posterior fornix. So if
You
you
need to
even have
write this down.
pressure the way you are taking notes. But that is not to say you cannot have sex in that position. It just means that you need to tell your partner that this position particularly can be painful for me, and he or she needs to take, well, he needs to take time in that position.
Mm. Mm.
Or you can find ways to help. Is it that you need to have a pillow to rest on? Is it that? So a lot of things can cause any of these. Is it just that the woman is just overtly dry and age has set in, the menopause? So in all of these, you find that how do you treat it? How you treat it is simple. You need to, first of all, take a detailed history. You need to
Mm.
find out, is there endometriosis? Is there fibroid prolapsing into the vagina? Is there any of these things happening? And then you need to then decide, is there any history of rape? You then decide the kind of treatment along those lines. Precious, in most cases, we find nothing, absolutely nothing. And
Mm.
how do you manage it? We just encourage people, give them lots of counseling, encourage them to do things together. I know some religious groups say pornography is forbidden, but I've seen couples that have been helped by watching pornography together. Because some people don't even know what to do. Get lubricants, water-based lubricants, not necessarily the ones that cause allergy. I know we don't want to mention trademarks, but I'm going to say this today for women here. Silk is good, it's water-based, it's natural. If you live in other countries where they have repellent, you can find those ones out as well. There are some water-based ones that will not cause problems. So there was a woman who was having a lot of pain during intercourse. And do you know what was causing it? Flavored condoms. She was
Mm.
just allergic to them. And it took a whole lot of time before it was ever discovered. So that's why I say a lot of these things, they are teamwork. You must put your head together. But I find that most women don't talk. A woman walked into
Mm.
my consulting clinic, an Asian woman, and she said she came for, well, what was written was that she came because she couldn't get pregnant. But when she came in, she said, I'm having pain down there. She couldn't even say the word. And it turns out that she came for something that was more psychosexual than something that was more gynecologic. So let's really talk about sex, precious. Let's talk about these things. And men, listen to these
Absolutely.
women. Okay, listen to them. Go listen to women because your own is coming. Oh, you know, men think that they are alpha and omega. By the time your own starts, you know, women come into sexual confidence from the age of 40. That's the truth.
Mm.
And by then, most men are on the law of diminishing returns already.
Mm.
That's the truth. Because they are now financially liberated, no children to look after. So they begin to look after themselves. All that hassle is gone. Their mental health is better. They are in charge. And most women come into their own after the age of 40.
Mm.
So men, get ready that those people you thought were not versatile after 40 days. And women, please research. I sat down and I studied Kama Sutra. I read it. I read that book from beginning to end. And I have a side thing I do, which is sexual counseling as a sexologist. So women research. It's not only men that will go and be researching and say, hey, come, I saw this style today. Come and do it. No, you also come and say, I saw this one today. Let's try it. And if he says, oh, now you have a new relationship, you are trying out new styles, know that that man was not meant for you in the first place. If he has no trust,
Mm.
because who says that he can come and tell you new styles and you cannot go and tell
And
him
you
new
can.
styles? Who made that rule,
Absolutely.
please? I don't know who made that.
Absolutely.
Yeah.
Absolutely.
And I think your
Yeah.
second question was loss of libido. Well, loss of libido is something
Yeah.
that can be, you know, women, we are very hormonal and our cycles, even sometimes in your cycle, in your periods, your entire monthly cycle, you're not just interested in anything. Yeah, one lady used to tell me, say, there are some days I just feel like vomiting, throwing up. I don't want anybody to touch me. I don't want sex. And I told her, just try and mark those days for me on your calendar. And it turns out it was during her ovulatory days. So we are very
Mm.
hormone sensitive and we are
Mm.
all different. For some women, nature wants you to be very sexually active during your ovulation. That's what nature wants. Because don't
Mm.
forget, nature's goal is to make a baby. So most women, you find that their sexual drive is high during ovulation. But for this one, it was the opposite. So everybody is different. And loss of libido can stem from things as small as you had a quarrel with your partner. You are just not interested. So things like you moved a new house, new job, you are anxious, okay?
Mm.
Or so things
Mm.
that may affect you, like maybe diabetes, new medication, some antidepressants like the SSRIs could actually
Mm-hmm.
cause reduced libido. It may also happen with age, you know, in the menopause, when the hormone that makes us very agile and active as women, estrogen, is gone because it's produced in the ovaries and the ovaries have shut down, then you could start having reduced libido and dryness and not just
Mm.
interested in sex. Or it may just be that the method of your partner puts you off. A man just comes and says, according to one of my friends, oh my gosh, translated, and let me do my thing. I mean, that will not make anybody have
Mm-hmm.
properly. So
Mm-hmm.
managing loss of libido is actually teamwork, communication, and a lot of patience. Loads of foreplay is advised. And then you can
Okay.
seek medical advice if this has gone on for over 6 months, you know.
Mm-hmm.
And there are many ways of managing it. And I think one of the extreme ways, one of my professors used to be the authority on managing this kind of thing. And one of the extreme ways is actually giving little doses of the hormone in men to women and testosterone. But it's not licensed, it's not over the counter. I think those days he used to use testogel. But in the menopause, some women could benefit from hormone replacement therapy. I will leave all of these for now because I know you are going to be asking a question
On menopause, yeah. We'll
on
talk about
menopause and
menopause. Yeah.
orgasm, lack of
Yeah.
orgasm.
Yeah. We're gonna talk about that. Let me just read let me just read a few comments because I think the tide is actually changing, when it comes to sex. People are actually beginning to talk. People are not quiet anymore. on this note, let me say what the next show is. So guys, if you're watching, if you're a woman, you're a man, you're a boy, you're a girl, and you're watching, our next show is on the 6th of December. Actually, that day is my birthday. So the
Ooh.
best birthday present you can actually give to me is to come on my show. And guess what we're talking about? It's all about sex. Okay? So we're talking about sex on my birthday. That is the best birthday present I can give to you as well. And I'm bringing a sex therapist all the way from the United States. Okay? And she's coming to tell us everything about sex. Bring it on. Whatever question you have, the different styles, the everything that you think is abomination, come and talk about it. If you know you can't ask questions, you want to be anonymous, send me private questions because I'm going to be sending her questions just like I've always done. And she's going to be answering all the questions. It's a mature section, okay? It's not for babies. If you know you're going to be shy, you're going to be doing like this, stay in your house. But
Don't
actually,
come.
I will encourage you to come on. It's for everybody. Trust me, you're going to learn a lot. Sex is a blessing from God. If you're not doing it, I don't know the blessing God is giving to you. So I'm going to read a few questions. Sorry, a few comments. And someone said, Kai, you have given Loretta a topic she's passionate about. That's so funny, you know. And somebody said, Miracle said, wow. Anu said, chai precious. I don't know what you mean by that. Vicente said, "This is so good and informative." And Miracle said, "And I've got two questions. I think you're going to answer it at the same time." She said, "What is the disadvantage of sucking the penis and the vagina?" This question is supposed to be my next show, but don't worry, doctor is there. Doctor is going to answer it on the medical aspect. Does it cause any disease? Which I think is quite good. Um, the other Omo, she just gave an emoji laugh. And another thing she said is, "What is good for the goose, obviously, is good for the." I think it was when you were talking about women just staying and the men are doing their things. They are not enjoying it. So Miracle said, this is another question following on from the first question, which you're going to answer together. She said, "I know of a friend that said her spouse is asking for anal sex. Please tell us the disadvantages of anal sex. Is it a sin?" So Dr. Loretta is also a Christian, so she can answer questions both as a Christian and as a doctor. So, ma, both questions, can you handle them for us, please? Then
Okay, so the
following
first
that,
one,
following that, ma, the both questions, can you just answer this one as well? What is orgasmic disorder? So that's the three in one.
okay. I can see this is generating the most question. What is orgasmic disorder? Okay, so the first question is sucking the vagina or the penis. What
Or the
was that?
penis, yeah. Yes. Is
So
it
sucking the vagina
healthy?
or the penis, is it healthy?
Healthy, yeah.
Okay, so I'll start with that one, and the second one is disadvantages of anal sex. Is that not the question?
Mm-hmm.
That's it.
Yes,
And the third
yes.
one is what is orgasmic disorder? All right,
Yes.
so sucking the vagina or sucking the penis. I think the question is um how clean is your mouth? How clean is your phallus, your penis, and how clean is the vagina? Um, Teeth bite. When I was in medical school, was described as the dirtiest wound you can come across, meaning that the mouth is full of microorganisms. Okay. Then one of my professors used to describe the vagina as a mini zoo. It's full of microorganisms that are supposed to keep it balanced. And
Mm.
the men, depending on how neat they are, how well they keep their penis clean, I don't imagine is the cleanest part of their body. So cunnilingus or fallatio jobs, which is what you will call um, sucking the vagina or sucking the penis, which of them, some people will call it head, whatever name they
Blow
want to give,
job.
blow job,
Mm-hmm.
tail, anything you want to call them or you want to call it. I think it's pretty much what stimulates the individual, what turns you on, what do you like to do, what would you do, Um, there are some people who would say they won't kiss anybody because they are not in love with that person or they just don't fancy it. and they rather give blowjob instead. But there are some women who will say to give you a blowjob, you need to be my only one and only partner in this world. You need to have gone to wash your penis before I suck it, and different things. But to answer your question directly, there is no health care or there is no health um, disadvantage per se with oral sex. However, there are diseases that may be spread in that manner. So you have oral herpes as well. You have some of these things that could happen. But it doesn't mean that there is anything that I will say, oh, it's because unknown to us, the saliva is an enzyme. It's a very strong enzyme. It breaks down a lot of things. It will digest a lot of things. Okay. And let me tell people something that watch porn for now. Let me just tell you people one thing. That porn is a film. Oh, people are just sitting there directing a film and making it real. So all of you that we see one woman putting her mouth and sticking it to the back of her throat and not vomiting, and you think she's just doing that as quickly, it is because the film has been enhanced. They can say,
Edited.
cut, oh yeah, shook your neck down, oh yeah, push it in, and then they'll continue again. And for those of you that we see an ejaculate, a semen that is like 1 liter pouring out into the woman's mouth, all these are films and stage managed. Okay. In real life, I don't think that there is anything particularly wrong with the choice of um, oral sex, i.e., blowjob, if that's what you and your partner like. You see, I always come back to what you and your partner like. If that's what you people like, if that's what gives you joy, I don't see anything particularly wrong with that. And I don't see where it is written in the Bible that is a sin. I've not seen it. Maybe I never read Bible reach there, but I've not really seen where it's consensual sex, and I've not seen where it's a sin for partners who are married in the Bible. Well, conventionally and in secular society, people do their blowjobs and they get kicks from it. And in terms of saying, oh, is it, and that was why I started, how clean is your vagina? Your vagina is not cleaner than that mouth, and your mouth is not cleaner than that vagina. They are both full of microbes. So let's get that right. Um, and if that is what turns your woman on, please try and do it for her. Some people call it washing plates. Because I see some men, they will go out and they do these things for small girls, but their wives in the house, they don't do it for them. And I'm wondering, why, and then you come and tell me, you come and consult me as a sexologist and say, oh, my wife no longer finds me interesting. Why would she find you interesting when you have been doing the same old thing for 10,000 years for her? And maybe she's not old enough because of the social cultural milieu to ask you, bros, can you change this thing a bit? Okay. So I don't particularly see anything wrong with oral sex. And if I go on to anal sex, I will say this and say it without fear of equivocation that there are a lot of microbes in the anus. There are a lot of microbes in poo-poo. Okay. So if I stick my penis into your anus, and then I bring it out and stick it again into your vagina. I'm
It
I'm
collapsed.
I'm just introducing. I mean, you are a microbiologist. You work in a lab. I'm just introducing a whole lot of bugs that should not be there. And sometimes that may not all go well for the pH of the vagina. And that place is very sensitive. God has made it. The kind of microbes that grow there are carefully selected by God. They grow and multiply at a particular pH, at a particular temperature. So all those women that, even apart from anal sex, that go about washing their vagina with all sorts of soap. The other day, someone told me that she was steaming her vagina to make it tight. And another one said a friend of mine manufactures a vagina stick that she says tightens the place up and all of that. And I just said to her that as a gynecologist, I will tell you, warm water is the best friend of your vagina. If you want to wash. You just wash the outside of the labia majora minora and all of that places. You don't start sticking your finger inside. And what are you washing? God washes that place by himself. It's
Mm,
self-regenerating. And if you
mm,
have to even use any washes for that central area, according to the Italian people, they'll say centro, that central area of yours as a woman. They are very gentle washes, like Firm Fresh,
I'm fresh,
very
yeah.
gentle ones, certified by the board of gynecologists that you use. And even at that Firm Fresh, you don't have to start sticking it inside and washing it, because the truth is, once you change the pH of that area, you become prone
Mm,
to either yeast infections, bacterial vaginosis, and you just alter the whole place. And
mm,
for your information, I want to tell you here today that there are some men who actually like the smell the way it is. And that's because there are special pheromones there that cause arousal. So one woman was telling me, he said, me, I always wash myself, keep myself clean. And my husband is going to sleep with the house girl who does not even wash herself, does not perfume that area, doesn't. I started laughing. I said, you washing and perfuming that area may just be what is pursuing your husband
turning
away.
him
You
off,
don't,
yeah.
because I'm telling you, these things are things people don't discuss, but things that we find out and things that we've read about, things that we've researched, and things that patients will sometimes come and complain about. Okay, that place has its own natural smell, which is arousing for the opposite sex. If you even watch animals when they're on heat, what does the male do? He's busy
Go to
smelling
sleep.
the
Mm-hmm.
sleep area of the woman. And man is
Mm-hmm.
an animal, animal. That's what we are. Okay. So that's that for
Inner
anal
sex.
sex. So use your
Mm,
mind to make your decision as to what you want to do with the anus of your partner. Although some women in religious places, though, precious, this has also come
mm,
to me, where you must be married a virgin, they start having anal sex to protect the hymen. So the hymen is not broken. So they are still virgins on
mm,
their wedding day. And because they started that early, they sort of get that enjoyment from that. And yeah, they could go on. Yeah. And then some men will tell you they find that the anus is tighter than the vagina, so they prefer it. But a word of advice to women today: if you actually do your pelvic floor exercises, don't go and start washing your vagina with alum and all those, steaming your vagina, because all that does is that it's tackling the mucosa, it's making it drier. But when you
mm.
actually work your pelvic floor muscles, when you do your pelvic floor exercises, that works your muscles. And with those muscles, you can decide to grip a man's penis. In fact, these are things you should be paying for consultation. During intercourse, and that actually gives him that feeling of a lot more tightness,
Mm,
okay,
mm,
than you going to go and run from pillar to post, and you're just destroying the vagina mucosa. The mucosa, by mucosa I mean the skin. You need to work on the muscles. And for the information of women, pole dancing pole dancing is something that will help you build your core muscles, and pelvic floor exercises.
mm,
So do that. And then orgasmic dysfunction is when women, despite adequate stimulation during the sexual process, do not achieve orgasm. I think the concomitant problem in men may be described as maybe erectile dysfunction, and maybe premature, well,
ejaculation.
ejaculation in men. And I think it's listed as DSM. See, there's a way we list diseases, so it's actually listed. And I think that a whole number of factors we've talked about here today can cause that. One, let me tell all of us here today, let me tell us here today, that it's not every time a woman has sex that she actually attains orgasm. And let me tell men, for your information, all those women you hear shouting, screaming, eh, all those is drama. A lot of it is drama. You know, society is just so interesting. And we get to speak to women in the comfort of closed rooms, closed doors. And I'm telling you that people just want to mimic or please what they've heard. They just want to pretend. There's a lot of pretense. The pornographic industry has not helped us. And then men now have a perception of I am some out of this planet kind of sex. Yeah, well, it's possible. Depends on who your partner is. But let me bring us to life or to earth with a thought. A lot of these things are state managed. So the young girls know how to scream and shout. Um, and some women have mastered the art. But orgasmic disorder in women can be linked to getting older, being in the menopause, um, diabetes, some medications, having had operations like total abdominal or total hysterectomy, the use of some medications like the SSRI for depression. And ironically, it can just be a sign of mental illness like anxiety, depression, stress, poor self-esteem. And it could also be a fallout of cultural and religious belief. So shyness in some religions. And we've talked about female genital mutilation. Genital mutilation is something we've talked about. And we've said that when you take off a woman's clitoris, you are just mortgaging her sexual enjoyment.
Mm.
When you take out because that is the organ of sexual satisfaction in most women. It's not the only one. It's not the only one, but in most women. So if you go there and you cut it off, most traditions say they cut it off because they don't want the woman to be promiscuous. But what then happens is that the woman has this orgasmic disorder and she starts to think it's her partner not using his implement well, not satisfying her well. Then she starts to hop about from man to man, finding the one that could actually satisfy her, not knowing that the organ of that satisfaction has been taken off. So you saying you want to treat sexual promiscuity with FGM, which is female genital mutilation, most times will cause the reverse. It will increase women trying to seek out that partner that can satisfy them.
Wow.
So I
Thank you
hope
so
I've
much.
answered
Yeah.
a lot of
You have
questions.
you have answered this question, and because we've got our next show is going to actually be covering everything about sex.
Exactly. So don't task me on that.
So, so we won't take so much of your time on that. If you've got any question, please keep it coming. Doctor is going to be answering your question, and I think have we got any
And you
question?
asked me, is anal sex a sin? That's one thing
Yeah,
you asked.
yeah.
Um, I will not answer a yes or no to that. The reason is because being a medic and science trained, we treat everyone devoid of race, ethnicity, religion, and it's the same
Mm,
way we approach issues. I'm not here to tell anybody what is sin or not sin, but I'm here to tell people what will optimize their health, women's health and sexual health. So
wow.
whatever optimizes, what floats your boat, that's it.
Yeah. Thank you so much. Guys, we're gonna I've my notes. If you see my notes, you'll be surprised. See me that is even anchoring the program. I'm writing so much because I've learned a lot. In fact, lubricant, silk lubricant. Did you hear that? I got that and I wrote it down. In fact, I'm gonna put it on the description section. I'm gonna find it. If I can find it on Amazon, I'll probably find it and link it. And I'll
And
probably ask
replant.
doctor secretly as
Yeah,
well. I'll,
replenish is good as well. Replenish is good
yeah,
for the menopausal
yeah.
women because you use that, you can decide to use that twice every week. You may then not need to use it at the point of intercourse because
Mm-hmm.
it has prolonged action. But it can cause
Right.
a lot of
Okay.
discharge. They are not harmful discharge. Just have a panty liner, that's it.
The good thing is water based. That's
Yeah.
what got into my head is water based. So
Silk
anything
is
that's water based can only be
and it's
better than
spelled
any other thing.
SY, not SISYLK.
Oh, SYLK. Thank you so much. I'm going to find it and I'm going to link it and other ones that doctor has mentioned and other ones that I think might be good for you. on the description section so you can find it and buy it off Amazon. If you have not, there's a video I made. I don't know if you saw it. 7 bedroom essential that every couple should have. Lubricants. When I made that video, you saw how many lubricants I had. So that's to tell you that even me as a young girl, I still need it. So let's go on to the next section because I can talk about this forever. So moving on to the next section, please, if you're watching this live section and you've not subscribed to my channel, please subscribe. The reason is because there are so many things lined up that you don't want to miss out. I don't want you to miss out. You wouldn't want to miss out on it as well. Follow me on Facebook, follow me on Instagram. I'm going to be putting like a card as well, just down so you can see my handle on Facebook and on Instagram.
I think
Okay,
I
moving
just
on.
remember something.
Mm-hmm.
Yes, 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 is another water-based lubricant.
Okay, YES. I'm writing all of
I don't
this
know they
because
have.
I'm
I
learning
think they'll
from
have them in good shops in Nigeria, but I know that Holland and Barrett, Boots, and all that they do. Yeah, Amazon. Amazon is a good place to find everything.
you. Yeah, Amazon
Best.
definitely. I would do my research. I would also contact the doctor as well to get a few more that she knows, so I can add it to the list and leave it on the description section because everybody needs it, very important. And one of the things that doctor mentioned now that I would want to echo is when your partner is using condom, just be very, very mindful that you're not allergic
To that condom. Oh, sorry guys, I have to. Just 1 minute. My thing has gone off. Can you? I have to put my thing on.
Your earphones.
Sorry. I have to change my modern technology has disappointed me, so I have to go back to my analog. Can you hear me, ma?
Yes, I can hear you
Okay.
very, very well.
Okay, thank you so much. So, just be mindful of the condom or the products that you're using. If you're using something and all of a sudden you start noticing like abnormality, just know that you may be allergic to it. So be very, very mindful, because I would never have thought that someone would be allergic to condoms. So this is a very good information
Yeah,
that,
most of them are non-allergic, but then there's a few of us who are very sensitive and like
yeah.
socially sensitive down there. Yeah.
Yeah, okay. So we're going to talk about another one that is so, so important to me that I always have to talk about if I've got any medical person, and that's mental health, right? Mental health is so, so important. Let me just tell you guys something. I don't know if you were here when I read the CV and the brief introduction of Dr. Loretta. Despite the fact that Dr. Loretta is very busy, if you don't know, she's a writer. She's got a book which she's going to be sharing with us later. She's a blogger. She's a blogger. She is a mom of
Right?
2 kids. She's a mom of 2 kids. But there is something I've observed about Dr. Loretta. She has a very good social life. Actually, some few weeks ago, I saw a video of her. She was dancing. I could not believe that Dr. Loretta can dance so, so well. She was having fun. I could see that she was having fun. I could see she was just having so much fun. And I'm like, oh my God, if this woman who has all these responsibilities, has all these, like, I wonder how your diary looks like. You would have time to actually have fun, not just with yourself. I saw you with your husband as well. Then you're the best person to talk about mental health. With that in mind, guys, what better ways can women look after their mental health and their well-being? That's the question, ma.
It still boils down to yourself. A lot of it, how are we raising women? Are we raising them to be self-confident people with proper self-esteem? Because that's what matters. Men, I want to tell us today that anybody at all can have mental health issues. Mental health issues are no is it's no respecter of person, it's no respecter of class, no respecter of age, no respecter of profession. In fact, hear me well and hear me today. Doctors and priests have been found to have the highest rates of mental health issues. And the reason is not far-fetched. They probably carry everybody's problems and they are bound not to speak out to any other person. And then you have things that happen to us in life, experiences. I talked about rape. It could just be having lost a parent at a young age, growing up in difficult circumstances, A lot of these things can trigger different things in our lives, you know, and every month as well. And then you also have, haven't given birth. We have things like postnatal depression, and we also have postnatal psychosis. But overall, you are responsible for your own mental health. I am responsible for my mental health. But that is not to say we cannot have a support system. We should use our support system, like Precious has just pointed out. We should look out for each other. If there's that friend that always used to call you and that friend is not calling you, try and find out, oh, what's happening? Okay. So tackling mental health, you have the conservative non-medical measures, and obviously you have the medical measures. The conservative non-medical measures is just your lifestyle. That's it, your day-to-day lifestyle. How do you see the world? Is it all dark and gloomy? Or is it that you see the cup half full? Or you take every day as a day that is going to be new exercise, new potential, something good is going to happen to me. I'm entitled to that something good happening to me. It's difficult. It's very, very difficult. But I think you should just wake up every morning. And this is how we should raise our children. Because a lot of these things matter. When I was growing up, it's in this book. I didn't hide it. It's there. Parenting goes a long way to tide us through what will come across in later life. Although we still need to help ourselves. My father would wake me up, and the first thing he would tell me is, Ta, my name is Loretta. He would say, Ta, how are you today? Did you sleep well? Did you wake up well? It's a glorious day. The sun is up. Get up and go into a glorious day and be glorious, you know? And there's a time he used to tell me every day, you are very beautiful. I saw you and your six friends walking today. Your legs are perfect. They are the best asset you've had. Flaunt them, show them. You know, he built my confidence. And there is no way I'm going to enter today. It doesn't matter. Be Donald Trump, Barack Obama, be Biden, be Buhari, be whatever you are. Your opinion of me does not affect me. My opinion of me is what affects me. Now, this
Mm-hmm.
is not me trying to say ignore societal ethics and all of that. No, this is me telling you that most of us, we live our lives for society. And without society knowing, society creates a recipe that destroys women.
Mm.
Because women are more concerned about body image, women are more, and men, okay? Not just women, but women and men. I told you, and I say it today, a lot more women attempt suicide than men, but more men are successful at killing themselves than women. So it's a universal burden. Hey, guys watching, draw your chairs closer. She may have been saying, Precious may have been saying, this is for women, this is for women. You will learn a lot of things from these as well. Mental health is no respecter of person. I know why I'm saying it. I know what there are days when I have been very down. I don't ask my friends, they'll just come and say, I'm under my duvet. I'm not coming out. I don't feel like, I just don't. So even that person, and that's one thing I will say today, those people who you see that are very vivacious, very happy, it's not as if they don't have any mental health load.
Mm-hmm.
It's just that they've decided to put it to the background. And again, please watch out for those kind of people because you don't see them coming when they want to harm themselves.
Mm-hmm.
People who you know are always moody, people who look out for them, do this, do that. And they forget that those people they think are strong, those people they think are pulling through, those people have needs as well. And these are some of the non-medical therapies involved in tackling mental health. Do what you love, pick out time for your hobbies, try and just block out naysayers. People who don't help your self-esteem. We all have those friends who do not help our self-esteem. You have no business hanging around them. I'm not saying be their enemies. I'm trying to tell you, don't let them feed your brain. Don't let them paint your canvas.
Mm.
You are your own artist. Paint your life with your brush the way you want to do it. Don't act another person's script. In this age of social media, I see people. I had a patient come to me one day, post delivery. In this UK, she came to me and said, She came because when she delivered, she had a tear. We call it a tear. So she came post delivery. So we examined her, make sure everything is fine. And as I was examining her, she had okay, but she just started crying. Why are you crying? She said all her friends look very beautiful on Facebook, and she doesn't feel that way. And I said, oh my God. I sat her down and told her that, do you realize that people take 30 pictures, select two finest ones and put on Instagram, after some of them have even altered it with filters, and you're here crying? I told her, no, 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 no. What I find is that social media is creating a lot of mental health issues,
Mm-hmm.
body dysmorphia situations, especially in women. Okay. The seaweed is always greener in somebody else's place. That's what they said in
Mm-hmm.
that cartoon, Little Mermaid. Yeah. But, water your own weed. Men, take out time to do exercises with your wife. Don't keep laughing at her. Oh, you are so fat now. After all, you made her have those babies that has changed her body image. Don't keep telling your wife, I like to eat pounded yam. She's struggling to eat salad. Try and start to eat that salad with
With
her.
her.
Because the more yam she pounds for you, the more she's going to eat that pounded yam as well. And you made a joy and dancing, precious. I would tell you, when I met my husband, I didn't like going to clubs or parties. If I would go to a club and be sleeping. But my husband loves clubbing. He loves partying. He will have exam tomorrow. He will go to club today. That's how I met him. That's how I married him. I can't change him overnight, but he has changed me. In this house now, sometimes when he's around, on a Saturday, we just put on music. Father, mother, children, all of us dancing. And that is something he has now instigated into me. I can even just take my bag now and say, oh, it's Friday night. Husband, where are you? I'm XYZ. Okay, I'm going to a club. And he said, okay, that's fine. Go. I'm using this as an example. Oh. I'm not saying all women should be going to club. What I'm trying to say is that find that thing that you can share. My husband doesn't necessarily like reading. But when I met him, I started reading to him. It's funny, isn't it? We'll buy newspaper and I'll read it to him. So then my husband listens to news more than I do. So you can see how things rub off. So it's very important. How are we raising our girl children? It is important for their mental health today and later on in life. And then in pregnancy, we need support system. And this is the beauty of the African community. Nigeria, countries, the 56 nations that make up the continent of Africa, they have a solid support system. It's
Mm-hmm.
even now that we are trying to copy the Westerners, that we are moving away from what makes us, what makes us unique. Women give birth here, they get home, it's silent. After that initial giddy 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 of, oh, congratulations, baby is lovely. You go home and it's just you and your partner alone with a child who keeps you awake, all night. It doesn't help. Postnatal depression is real. And
Mm-hmm.
one of the core ways we even manage this here is a support system, cognitive behavioral therapy, sending midwives to the house, getting the mental health team, specialist mental health midwives to follow up. And then we can then go on and think about medications when we've assessed. And if it is very, very bad with psychosis, obviously you may want to section the woman. When I say section, it means keep them away from their baby and other people so they don't harm their babies. But let us make use of our own support system. My mother-in-law, my elder sisters, they helped me a lot raising my children. I don't think every other person has that advantage. In fact, I tell people that sometimes I feel like a fraud. These people really, really helped me. But I find that some of us even have some of this support system. And maybe because of I too know, or maybe because we want to pretend to be Oyimbos, we are not employing them. The other day, a friend of mine was telling me, I beg, I don't want my sister in my house, so she will cause too much trouble. Oh, what of your mother-in-law? I don't want my mother-in-law. She will present too much problem. Okay, your mother can come. My mother and her wahala. And I said, at this rate, if everybody around you is bad, then please carry a chair and examine yourself.
Mm.
And the truth is that to live with people You must compromise. You must make sacrifices. And if those are the sacrifices to maintain a proper mental health, then you may have to do it, because sometimes we each can get overwhelmed.
Mm-hmm.
But if you are assessed by the care providers and they think you need medications, then you don't necessarily have to decline. You could try the medication as well. And if there are triggers in your life, i.e., things like domestic violence that trigger mental health issues, then you may need to save yourself and save your mental health burden and walk away from abuse. There's no use staying in an abusive relationship. It doesn't help anybody. So our mental health is very important. There are conservative ways of managing it. Diet optimization, exercise. When you do exercises, you release endorphins. Endorphins are feel good hormones, and they're going to help you to feel happy. They're even going to help you to have nice, healthy sex as well. So exercise, exercise, exercise. And exercise is not necessarily the intensity, but the consistency.
Mm-hmm.
So it's not about running 1 mile today, then you don't do anything for 3 weeks. You must be consistent. So if it's every 15 minutes, you just dance. I dance with my dumbbells. That's most of the time what I do. If you have the money and you can afford some things that can help you, like the ab trainers, it's all on Amazon. Instead of buying that Louis Vuitton bag, go and buy that ab trainer. Invest in
Mm-hmm.
that one. Instead
Mm-hmm.
of buying that shoe, buy yourself a power plate.
Mm.
Okay? And help yourself, help yourself, help yourself.
Wow.
In the menopause, when women start having um maybe depressive episodes, it may just be the estrogen withdrawal and all of that. So sometimes hormone replacement therapy could help as well
Yeah.
for that.
Just before you go on, because I would like you to just talk about it, because we're rounding up now. Actually, we've actually spent good time, and I can tell that all of you can actually testify that it's a time well spent. You've actually been blessed by Dr. Loretta this evening. But we want to talk about menopause. One of the problems, or one of the things people think about when it comes to menopause, is the fact that they think menopause is for the over 50s and the over 45. So for we that are in our 30s or in our 40s, we don't bother about menopause. It's not a problem. Let's just enjoy our life, okay? So I've come to understand that menopause is genetic, right? It's something that the way your mother is struggling with it now, you are likely going to struggle with it. So why not get informed? Why not learn as much as you can now that you have the time, watching your parents or your mom struggling, so that by the time you get to that age, you have all the information. Like doctor said, every decision you're taking is based on the information that you have. So don't run away. Don't think that this section now is for old people. No, sit where you are. You're going to talk about menopause. How should we prepare for menopause? And what advice would you give to women experiencing menopause at the moment?
I would say preparing for menopause starts from today, starts from now.
Mm.
Preparing for menopause actually even starts from when we are born. That's the truth. Because it's something that's going to happen. And in case we don't know, there's also the male menopause. I'm not going to go into that today, but it's also there. So, how are you living your life now? Because what's going to happen is that the ovaries are going to burn out and stop producing their hormone. The primary one of which is the um, estrogen, and you're going to have all the other ones, LH, FSH, all those hormones. Let's just leave the big words. I don't like to use them, but just know that that thing that makes you young and supple is going to go. And then I've also told you now, I'm just giving you one expo, that when you do exercises, you release endorphins, feel good hormones. So imagine that if you started today and you say, okay, I'm going to be doing exercises regularly. It means you're going to be feeding your body endorphins on a regular basis, isn't it? And you just carry on like that. Then you say, oh, when I wake up, I'm going to make sure I drink water first thing in the morning for my skin. And last thing at night. My friends don't know me. They will tell you, I drink water and drink water. I'm just a water guzzler. You know, now you're already preparing your mindset. And then you're going to say, oh, I'm going to make sure that I don't put weight. This is the healthy BMI I want to maintain. Therefore, I'm going to watch my diet. I'm going to avoid too much white carbs. I always tell people, eat everything, but in moderation. I'm going to avoid too much white carbohydrates. I'm going to increase my fruits and vegetables. And then I'm going to make sure that I don't eat late at night. And even if I have to eat late at night, I'll make sure that I don't go straight to bed immediately. And I'm also going to make sure that during sex, I call it sexercise, that I'm happy and I'm active. Because some women will just lie down there. They don't know that sex is a good time to burn calories. You know, tell the man to relax and you do the sexercise for him. And if you surprise, he'll give you a blank check. Plus, you've lost weight, you've lost calories. You know, don't just lie down there like a dummy. Anyway, that aside, you are doing all this preparation, you are doing them, and you are already preparing a good template for when you go into the menopause. Because when the hormone ceases to bathe your body, most things that will begin to happen is dryness of the skin, sagging, and all of that. But if you are exercising, you are toning your skin all the time. If you are drinking enough water, you'll be moisturizing your skin all the time. Get yourself a good moisturizer and spend time on yourself. I watch some people, and my daughter is testimonial to that. You have a good moisturizer, say maybe one of the nice brands, even just rose water and glycerin is a very good moisturizer because it pulls water from the atmosphere and make sure it stays more on your skin. Now, you don't even take time to apply that to your skin. Where are you rushing to? You want to rush to go and make money. My dear, the time you spend on yourself is what is important, is what matters. Take time out to rub that your skin every day from now. In France, they say French women don't age on time. But it's because they start using anti-aging and they do proper moisturization from very early in life. And if you're even a black woman, black don't crack. All you have to do is just a bit tiny work. And I find that some people can't even dedicate that time to themselves. They can't. You can't even do a measure of exercise. You can't do anything. And then the menopause is looming. So if you are not preparing already, and then you get there unprepared, it may hit you. The other thing which Precious mentioned is something we should take note of. You probably will act like your mom. So if your mom had an early menopause, get ready, you probably have an early one. Then there's something I must mention today. There's the period around the actual cessation of the menses called the climacteric. And that varies from woman to woman. So you may find that a woman's period may actually stop at the age of, say, 50. But then she's been in climacteric for maybe since 45 years of age. And in that period, in that time duration, the periods become erratic, they're a lot heavier, there's loss of libido, there's a lot of mood swings, things that just don't add up. It may actually be climacteric. So we must have and take note of that. And this is not the time for the man to run away and say, oh, I'm going to go and look for a 25-year-old. Because the truth is, if we as women get the encouragement and we manage ourselves properly, I said it before, you come into your own in terms of financial confidence, sexual confidence, even knowledge confidence, experiential confidence, round about the age of 40. 40 is the new zero. Okay. So if you manage it well, that is when you even find that women become more attractive to the male folks. But the question is, how do you manage it? And then in terms of medications, if you want to, some people say they found um, primrose oil healthy and they've used it and it helped them. Others just say they stick to multivitamins and they are regular with it. Consistency again. There's no use you buying Centrum or Well Woman and you remember to take it once every 2 days. Consistency. And if you get a brand, one brand is just okay, stick to it. Don't go and pack all the multivitamins in the world and start swallowing them because unknown to you, The oil soluble vitamins, you can have an overdose of them. The water soluble vitamins, yeah, that's fine. You could just pee them away. But the oil soluble ones like vitamin D, vitamin A, you could have an overdose of them. Okay. So, but it's important at this early age, get yourself a supplement and stick with it. Always use it.
So
The
are you
other,
sorry? Are you saying that for those of us that are not yet in that phase, we
yeah,
can
yeah,
start taking the multivitamin
yeah,
now?
yeah. Just get
Right.
yourself one because they come in ages. You have under 40s, you have 50 to 70, you have over 50. Because sometimes, but that does not replace your food nutrients, the
Exactly.
supplements, and don't overdo it. So get one and stick with it. Just get one and say, okay, I'm just going to be taking XYZ. I will stick with that. Look for the one that is age appropriate because they do ages for a reason.
Mm.
Don't go and get the one that is for 70-year-old women and then you are taking when you're under 40. But get into that habit and carry on.
Would
Okay.
you be able to mention, like someone said, can you suggest a good skin moisturizer, please? Or can
I've
you
just told you
suggest,
one. I
can you
just said one. I said rose water
rose
and
water?
glycerin by Boots. I swear by that. Add it to whatever cream you are using, rose water and glycerin by Boots. And then Orioyo, Ori, non-processed Orioyo. But because it is smelly, I use it only at night.
At night.
Um, and then I've found from my experience that shea butter Jeggings is also very, very good. Don't necessarily go looking for the most expensive thing. It's consistency. Rose water and glycerin from Boots is something I've used since my 20s and
Wow.
I still use it.
You can tell the
Yeah, I still use it.
you can
Yeah,
tell just by looking at Dr. Loretta. You can, because I was going to ask you, from the first time I saw you and up till now, I can see, because you're very light skinned, and
yeah.
people who are very light skinned are prone to having marks and what's it called, spots on their body.
Mhm.
But I have not seen, forget that Dr. Loretta is wearing makeup. I have seen Dr. Loretta with no
Without makeup.
makeup. She
Mm-hmm.
doesn't have anything on her skin. In fact, the last time I spoke to you, ma, I was almost going to ask you. I said, let me not push it too far. I was almost going to ask you, how do you maintain this skin? Like, Dr. Loretta glows, like honestly glows. So you see this thing Dr. Loretta is
I'm shy.
mentioning. We are actually, in fact, guys, let me not put it on guys. Make sure you order it tonight. If you're in the UK and you're watching this program, don't wait until your husband buys it as Christmas present. No, order it tonight or order it by the end of this week. That money you're going to use for what's it called, Costa Coffee or something, use it to buy this for yourself this week. That's one good thing that you will do for yourself. Carry on, ma.
So I'm saying that healing comes from within.
Mm,
And it's the same thing for the skincare you are talking about. What do you eat? What do you drink? Fizzy drinks are a no-no for your skin. That's the truth. Fizzy drinks are a no-no for your skin. They are a no-no for hypertension. They are a no-no for diabetes. You
mm.
don't need, in fact, the worst thing you can do to yourself is to drink fizzy drinks. I'm very serious.
Okay.
It's the worst thing you can do for yourself. You can take them maybe once in a blue moon. Yes, why not? Excuse me, can
Bless
I
you.
have tissue from there, please? But it's the worst thing you can do for yourself.
Wow.
Okay? So avoid that.
Somebody's asking, do you mean ori shea butter,
Yes,
or
yes,
as the orioyo? I don't know what the difference
yes,
is.
Ori, shea butter is what I mean.
Okay.
And it's Ori or your where I come from.
Oh,
And let
okay.
me just elaborate. Anything you are using at all, rose water and glycerin by Boots is very inert. When I say inert, it doesn't react with much. And what I did over time, what I've discovered, I just got these spray cans that you can spray. So
Mm-hmm.
I just come out of the shower and my friends who know me will tell you, I won't towel myself. There's no need. I just This is when you have time. This is not when you are rushing to work. So it's probably your evening regimen. And just spread the rose water and glycerin on your body, and then use your own moisturizer and your own cream and go on. Or you can put that rose water and glycerin into your cream as well, because it's that inert. It's not going to react with it. And that's not like mixing anything. It just helps your skin retain moisture.
Is
And you
that
need that
safe?
moisture.
Is that safe in pregnancy as well?
Oh yes, rose water and glycerin is completely safe. The water from the rose and glycerin, glycerin is something we even drink sometimes. It's sweet when you want to open your bowels in a different form. So it's completely innate and it's safe in pregnancy. One thing people use a lot in pregnancy is this thing, a bio
Bio
oil.
oil, yeah.
Yeah, but I'll tell you that bio oil and ori or your is just out of this world. And if you can get it and just be consistent and use it, and this prepares you, ties you into the menopause. If you see my mom, you will not believe that she's 70 plus, because my mom was the first person who taught me how to actually moisturize my body from head to toe. No part is left. She would tell me, it's your body, it's yours. And that also affords you time to look at your
Your
whole
body
body. If you
properly.
see a
Good.
spot that was not there, you now know that it was not there. So moving on, in terms of the menopause, find yourself an activity that you like, and then you do it. Don't be alarmed if you start having your hair falling off, because that could be a sign for some people. Don't be alarmed if you just, one woman the other day was crying that her hair was falling off. Sometimes it could just be due to the menopause. And that is not the time for you to say, oh, I'm not old. All these things are for young girls. I'm not doing my hair. I'm not doing this. No, keep young people around you. Age is just a function of the mind. And then in terms of libido, yes, it's also a time you have reduction in libido because estrogen is gone. you know, Seek help, hormone replacement therapy, if it's suitable for you. It's not suitable for everybody. So seek help from your healthcare providers. And at the same time, tell your partner the changes that are going on. Some of us women, we don't talk. It's not even every time we blame partners. Some partners don't know. You expect them to be spiritual. Say, hey, you should know now. Can you not see? No, men are not like that. You need to tell them. I used to make that mistake. And my husband say, you didn't tell me. Am I a ghost? Am I a spirit? How am I going to read what you are thinking inside your head? You know? So I've learned to actually tell him, oh, this is it. And he says it in fairness. There are many men are like that because they reason in black and white. They're not like women who we can multitask. You can look and say, oh, look at how this person's face is on me. A man does not have time for that. Let's cut them some slack as well. I find that these days many women are becoming men haters. That's not it. You should be men groomers. I'm not trying to say women don't do your task and raise your sons well. That's not, and leave the job for one innocent woman that's going to come and marry them. But talk to them, tell them, this is happening. Oh, I'm feeling a lot more dry. You have to be patient with me during intercourse. Let's invest in a good lubricant. Let's invest in a good bedroom atmosphere. Nice lights, nice mattress. Not using
Eje.
one mattress for 20 years. Lovely bedding. Some women will not buy bed sheets, but they will buy all the shoes in the world. And I'm wondering how you're going to have and enjoy sex in that kind of environment, you know? And even in the menopause, these things matter. So, and then if you are unwell, if you have primary medical conditions, some of the medications can actually cause loss of libido. And we know that a lot of these conditions happen or manifest in the menopause as we get older. So check with your doctors as well.
There is a question here. Someone say, do you miss the rose water and glycerin in the spray bottle? Do you mix it together?
People are very interested in this. Okay,
They,
so
they want to know what's
rose
good.
water, um, I could actually get a bottle of it. Rose water and glycerin by Boots is one thing, is one
Oh,
liquid.
together.
Yes,
Right.
young
Okay.
man, go and get me my rose water and glycerin. It's one transparent liquid, almost like water when you are looking at it. In and for your face, you could use it as a toner toner in the sense that it closes the pores, not toner in the sense that it lightens the skin. So it does, it's a humectant. That's the rose water and the glycerin. It means it will pull water from the atmosphere and absorb it. So if you have it on your skin, it's going to do exactly the same thing for your skin. I see a lot of women and I look at their feet and it's all cracked and unsightly, you know, and it's just because you've not maintained it all these years. And then you get into the menopause and the dryness becomes even worse. You know, Ori is very good for you to massage your feet with last thing at night before you get into bed. And there's nothing that stops you from having a pumice stone in your bathtub. And just, every day you just like wash your leg, So this is at the risk of me advertising this product, which is not what we set out to do, but this is rose water and glycerin.
Oh,
And it's
okay.
boots. It's traditional boots product,
Okay.
skincare. Yeah. You
Yep.
can see it's just like water. That's what it's like. So you can just get a spray can and spray this all over your body. It makes it easier. Or you can mix it into your cream. It depends on what floats your boat, but it's very inert. Any cream you're using, if you have dry skin, if you think your skin is very oily on the face, then don't use it in the daytime. Use it only at night.
At night,
Because
yeah.
the truth is, if you have oily skin now, before the menopause, after the menopause, it's going to get a bit drier. So those of us who have oily skin and we are complaining is a blessing in disguise.
Okay.
Because the drier ones will become drier,
Dry,
the
yeah.
oily ones will get
Dry.
drier, and the combination ones will also get drier.
Wow.
So the menopause is a very interesting time. It will
Yeah.
come to us all. It's not something you should be so much afraid of. I think if we manage our expectations right from today, and we manage it as a team with our partners, men, help your women, okay? Be patient with them because the time will come, they have to be patient with you. I tell most men, a man who lives long, that a woman took care of him. So take care of that woman now to take care of you. And don't harass her and say, oh, you are now too fat. There are gentle ways of telling somebody something and helping them to get into the groove. My mother used to ask one of my friends, you are planning to lose weight, you are doing all these exercises by yourself. Why does your husband not help you? And one day she even asked the man directly, why don't you help her? I mean, sometimes I don't even want to write anything. You said just now that I'm a writer. I want to write anything. My daughter comes and says, come on, mommy, get up and write. And just her doing that, I write. Or my husband comes and says, oh, write today. Although most times he doesn't remember. I'm the one who has to help. But when you have that person helps you do something, it's very, very
Absolutely.
good.
Absolutely. Wow. Honestly, thank you so so much. You're gonna give your last words, but I've you want to see my notes? It looks like I'm going to write a book after this section because I have written so so much, so so much that, in fact, as soon as I'm leaving this section, I'm going online. I'm going on Boots. Boots is going to see me tonight. Okay, I'm going
They
to be
should be giving me commission.
honestly, I'm gonna be asking Boots that we are coming. Some ladies are coming to visit you, okay? And I'm also gonna check on Amazon because I know some people don't have Boots where they are. I'll see if I can find it on Amazon and put the link as well so people can buy off Amazon depending on where you're watching from.
Yeah. And in
Uh,
books, it's not that expensive. It's about £2 something.
can you imagine? This
Even in
if
Nigeria, it's there.
yeah, you see, this is the problem that we have. Something that you just said that's on. I've learned a lot, but there's this thing you've mentioned about moisturizing our body. I can tell that half of the people watching, including me, we don't moisturize our body very well. In fact, our back probably have not seen cream in the last years or years and
That,
years and years
that's not nice.
because most times you're rushing in the morning, you're getting kids ready for school, you're doing stuff. We don't, but now that I've learned, obviously you go to work, you shower in the morning, in the evening you shower. Now I know that evening routine will have to be me spending good 30 minutes and doing my evening routine, because if you can't do it in the morning like the doctor said, do it in the evening. Look after yourself, make you your responsibility. Your husband or your partner may be there to support you, but that's not their job. They may not even remember to even look after themselves. How much more
You
look
know,
after
you
you?
know, some of us just get into relationships, not just only with partners, even, but even friends and all that, thinking that it's their responsibility to make us happy. No, no, it's not. It's our responsibility to just to remind us our hands age a lot quicker than any other
Mm,
part of our body
it is
because
true.
we're always washing.
Washing.
And now in coronavirus times, we are using these harsh alcohol gels.
Mm.
Please put a hand cream in your kitchen, put a
Mm-hmm.
hand cream by your bedside, put a hand cream in your handbag, put a hand cream in your car. Okay, because it is important that you always moisturize your hands. They are the first part of your body to tell your age. It's very important. I find that a lot of us we forget that the most hardworking part of our body is actually our
Is
hands,
our
especially
hands.
as women. And me as a doctor and as a surgeon, I'm always scrubbing up. So there are some days all I do, I just soak my hands in warm olive oil, and there's a
Wow.
hand cream everywhere. It doesn't
Wow.
cost you much sometimes. A lot of these things is not highfalutin. It's just maybe knowledge and maybe just that
Knowledge.
will, you
It's
know.
more knowledge. It's more.
Yeah,
It's
just
actually
put it
more
by
of
your
knowledge.
bedside.
Yeah. Honestly, guys, on the comment section, just as we are rounding up, just keep it coming. Like, thank you so much, Dr. Loretta. That's all I want to see. Thank you so. Me, I'll be typing my own as well because I'll have to type it. Thank you so much, Dr. Loretta. That is what we want to see. And just to remind you, on the 6th of December, which is my birthday, we're going to be having a show, and that show we're going to be talking about sex, everything about sex. Bring your questions, or if you can't ask the question directly, you can send it to me either via Instagram or Facebook, or either message me directly as well. We're going to be having a proper therapy section with our one and only therapist, sex therapist. Don't worry, when she comes you will know why she's a sex therapist. And guess what, it can only be a woman that's going to do all these things. So she's coming on the 6th of December. 6th of December is a Sunday as well. So come prepared, invite your friends. The flyers are going to be coming out very, very soon. And you're going to, I'm going to share it. So when you see it as well, share, share, share. So on a final note, Dr. Loretta, just in summary, I know I'm meant to ask about lifestyle, but maybe you can include that. In summary, how would you advise ladies, women, both the young, because you're talking about both children as well, we as mothers should be helping our kids as well, so women in general, how can you advise us to be able to look after ourselves properly?
Um, in summary, I would say that I want to take us back to the definition that WHO has for disease, where it says that um, health is not merely the absence of disease or infirmity, but it's actually a state of physical and psychological well-being as well. You know, some really put. So I think we need to raise the girl child. And I keep going back to this, and people may just be wondering why. It's in my books. The the two books I've got, especially My Father's Daughter. This book is on Amazon.
I'm going to
You
link
are
it.
going,
I'm definitely going to
yeah,
link it on the
you're
description
going to
section.
get some key tips from this book about being able to understand your own self-worth, having value for your own self, having self-esteem is not the same thing as being proud. Knowing who you are is completely different from being proud. You know, it means that you understand that you have value, that you are worth it. You are worth every single thing that comes your way. And nobody can make you feel inferior. That is the beginning of a good mental health. And you need a good mental health for you to actually, even WHO has said it, for you to ward off even physical illnesses. Because there's what we call the psychological basis for diseases. And there's something like psychosomatization sometimes, where it's just all in the mind. I have got a second novel called Heartwebs, and it's also on Amazon. And I mean, this is really interesting. I wrote it, but I still find it interesting also today when I read it. And all you have to do is type in my name on Amazon. If you're in Nigeria, Terraculture has got copies in Lagos. And obviously, if you ask Precious Derrick, I can give you phone numbers of those where you can get your hard copies from. And Okada Books have got electronic copies. So, my message from the girl child up to the 198-year-old woman, I'm just talking of the extreme. The key to happiness in life is to first of all make yourself happy.
Mm.
When you are happy, it's like a bank. So when you fill your own bank, then you can issue out checks. If you've got money in your account, you can issue out checks. Can't you, Precious? So
Absolutely.
if you are happy, if you make yourself happy, it means that you've got a lot of emotional balance. Your bank balance is high. Then you can issue out checks. Then you can love others. Self-love is not the same thing as being narcissistic and being self-centered. No.
Mm.
Self-love is when you actually take time to take care of yourself, know you've got value. And if you find out, many people who love themselves, who are are self-confident, are those who actually love other people,
Other people. True.
are those who actually do projects that
True.
change the world.
True.
So it's very important that you find those things that make you happy, that you research and research and research. We're in the internet age.
Mm.
Your internet, your data is not just for WhatsApp gossip,
Instagram and
Facebook,
Facebook.
Instagram, looking at other people's pictures. Education has never been simpler at the touch of a button like it is today. Look, there are sometimes all I do, I just sit down and listen to speeches, TED Talks.
TED Talks. Absolutely.
Promote your mind, and your mind will then promote you. Seek out mentors. They don't need to be near you. You can have far away mentors. You can have close by mentors.
Dr. Loretta
And
can
two,
mentor you as well if you want that.
yeah, people's lifestyle can mentor you. You can just decide that, oh, I want to read about Mandela, everything about Mandela, and pick the good things. There's no perfect person, but pick the good things about Mandela
Mm.
and leave the bad ones for him. I can decide to pick the good things about Precious that will
Mm.
mentor me, and I'll leave her bad ones for her.
Mm-hmm.
You know, So I think going away, these are the things I will leave people with, because even though we started out talking about health in a scientific fashion, in my experience and in my lifetime so far, I've found out that a lot is hinged on the softer things, those non-palpable psychological, mental things that affect how we view life. So
Mm.
on that note, I will tell all of us, boys and girls, men and women, get your copy of this book, My Father's Daughter. Some have called it a parenting manual. Others have called it a life guide manual. Some say it's a self-help book. Read it and tell me what you think about it and what you want to call it. Thank you.
Wow. Wow. Honestly, I wish I can just be clapping, clapping. But anyway, don't worry. Don't worry. Let me reserve my comment. Thank you so much, Dr. Loretta. Thank you so much to all our audience. Thank you so, so much. You've spent 2 hours plus with us. I am so grateful, and I believe you've learned a lot. Dr. Loretta, I don't know what to say, but one of the reasons why I invited you was when I listened to you talk about women's health as well. You won't believe that she talked about women's health yesterday. She was actually on a Zoom call this afternoon that was supposed to end 4 o'clock. I was like, oh my god, I hope she can go on my show this evening. Oh my god, I was just praying. But she, from that show, she came on this show, and God knows what she has for the rest of the evening. It only takes someone with passion to actually do what she is doing. Thank you so much, Dr. Loretta. I don't have anything to give to you, but I know that God Almighty will bless you and bless your
Amen.
family and bless everything around you. Thank you so, so much, ma. I do appreciate you. Bye, guys.
God
I'll
bless
see you
you too.
guys on the 6th of December, my birthday. Don't miss it, please.
I
Thank
will
you
miss
so
it.
much.
I'll log
thank,
in. God bless you too, and
thank
God
you.
bless your entire team, and
Thank you.
bless your entire support system,
Thank you
because you
so
must
much.
have one.
Thank you. All right, guys. See you later. Have a wonderful Sunday evening and have a beautiful week. Bye for now.
Thank you.